Good morning, Joanna. Hi, Jeremy. How are you?
Morning. Good, thank you.
Hi, Oreo. Hello. Such a beautiful boy, aren't you? I think he's the prettiest guinea pig in all of Isleworth. Would you agree?
Yeah.
Yeah. And he's got a little brother at home as well, hasn't he?
Yeah, Captain Scott.
Captain Scott. It's a pretty cool name. Yeah, you can't really beat that, can you? Come on then, little Oreo. Let's go and have a little chat about you, shall we? Come on in the consult room. That's it. Joanna's normally a very chatty child, but she seems very quiet, very subdued. She's worried about her guinea pig. So did he make any noise when he slipped off your lap?
Yeah, kind of like a really high-pitched squeak.
Okay. Oh, that doesn't sound very good, does it? Okay, well, let's have a little look, shall we? So I'm just going to have a little feel of his back area there. Good boy. So far, so good. Not making any noise there. Hey, lad. Hey, good boy. Oh, wow. He's really passing quite a lot of poo, isn't he? Does he do this a lot at home as well?
Not this shape.
Wow. He's really going for it, isn't he? It's like raining guinea pig poo at the moment. Well, better out than in. Hey. Oh dear. So a guinea pig's leg shouldn't be able to do that. The fact that it can come out on the side like that. So I think there's something quite seriously wrong with that leg there, unfortunately. It happens all the time. So no one should feel bad. They're not like a cat that can spin around and fall beautifully on their legs. They just take the full impact on their legs. And unfortunately, I think that something has gone quite badly wrong in that leg, which is why he's cried out in pain. So what I'm going to do now is I'm going to take him downstairs. We're going to perform an X-ray. Okay. And that'll just allow us to understand exactly what's going on with that back leg.
Great. All right. Well, I really appreciate that.
Yeah.
Thank you.
Poor boy. You going to say bye to Mummy? Yeah?
Pix, come on, there's a good girlie. Is this all different, Pix?
In West Sussex, rescue dog Pixie is enjoying a walk with her new family before heading in to see Scott.
Right, almost at the top. Keep going.
The little pup belongs to expectant mum Katie, but it was her mum Daphne who first discovered the tough little street dog during a holiday in Italy. Daphne witnessed Pixie caught in the middle of a horrifying dog attack.
She was literally covered in blood. It was all over her face and coming out of her nose, out of her mouth, and she was just screaming, really screaming. Good girl. I was nursing for 37, 40 years, but that was one of the most awful things I think I've ever seen, really. It was... I can't describe how bad it was. It was just terrible. The eye was bulging right out of its socket, the whole eye.
The badly injured pup was immediately taken to the local vets, where she underwent life-saving emergency surgery.
Pixie wants her tummy rub.
I know, look.
She loves her tummy rub, doesn't she?
Yeah, she
loves tummy
rub.
Daphne relayed details of the shocking attack to her daughter Katie back in the UK. And when Katie saw the pictures of Pixie, her mind was made up to adopt the brave little dog.
Me and my son were looking in my emails and we both fell in love with her. And we thought, if she survived this long, she's definitely worth the fight. And we'll try and get her over here. You're such a good girl, you are.
The family then had to raise enough funds to bring Pixie back to the UK.
The moment that she was in my arms, it was just sheer relief. She put her paws onto my shoulders and she just snuggled into my neck. I was in tears because I didn't think she was coming, and she curled up and went to sleep.
She's a lovely little dog.
But Pixie still has a tough battle ahead. The dog attack has left her with serious ongoing issues.
Both of the eyes are weeping.
Are they?
Yeah.
Oh, gosh.
We know one eye she definitely can't see out of, and we need Scott to see how much she can see out of the other eye as well. And the other problem we have is if she's in a new place, until she knows where she's going, she walks in circles and she bumps into things. When she gets discombobulated, that's what she does. Come on, Pix.
Katie is hoping Scott will be able to help her brave little rescue dog.
Although she's only been with us 5 weeks, she is a massive member of our family. Her personality shines through, and it's making sure that she is happy and healthy.
Come on, good girl.
And having seen Scott and the work he does, it's in his hands now. Pixie!
Come on, come on.
Back at the Isleworth practice,
Hey, Gina.
Scott and
Little
vet nurse
Oreo
Gina
here.
are about to x-ray guinea pig Oreo's broken
Such a
leg.
cutie.
What happened to you?
Problem that happens up and down the UK on a regular basis, that these little animals get hugged within an inch of their life by their usually young owners. And sadly, this guy decided to leap off little Joanna's lap and has definitely injured this back leg. So you can see that's far from normal.
Yeah. Yeah, I can see that. We can fix it, can't we? Can't you?
I think so. I think we can give it a good go, definitely. All right, let's go through to X-ray. All right, so let's put our little man on the table.
An old glove box is used to hold the little pet still enough for the x-ray.
Good boy.
He looks quite comfy there.
Yeah. X-ray. Oh,
Ouch.
it is very significantly broken leg. That looks like it would have hurt a lot, but he has fractured his femur. It's a break right through the middle of the thigh bone there. So we're going to need to perform surgery on this boy and try and fix his broken leg. You've been incredibly brave, haven't you? Hey, poor lad. Looking at this X-ray, it's very clear that Oreo has likely been in quite a significant amount of pain. Breaks right there. Oreo is safely under anaesthetic. He seems to be responding well. I can hear his lovely heartbeat in the background, which is making me feel happy. So now it's just about getting on with the job at hand.
Scott is going to need another set of hands during the delicate surgery, so vet Phoebe is called in to assist.
Hi, guys.
Hey, Phoebes.
Is this our little guinea pig?
Yes, little broken guinea pigs. I'm just trying to find the ends of the bone at the moment.
Wow, that's not just a minor break, is it?
No, it's pretty significant, isn't it? So the problem is that with the fracture occurring, the muscles have contracted. So you've got real tightening. So you've got an overlap of these bones. So what I need to do is just gently encourage them to stretch again. Okay, this is going to be tricky. Okay, so can you see there's the other piece of bone there? Okay. So what I need you to do is to hold that in place like that. So now it's a case of what we need to do. So just with that hand, let's just try and stretch the leg just to get those two pieces back into alignment.
Looks like you're getting somewhere.
It is quite tricky to try and complete a surgery like this on Oreo because his bones are really tiny and you can't see the intricate details quite as well as a larger animal. Yeah, it's actually a crack.
Oh no, that's not good.
There's a crack going right up, like really far up into the femur. I don't know.
Scott has now discovered a nasty crack in the bone, and that means it's far too fragile to be pinned.
Sometimes you can see cracks on X-rays and sometimes you can't. And in this case, it's a very small animal, so this line is going to be just microscopic. So there's a fragment of bone there.
Oh.
And that is full-on shattered, unfortunately. Now that's out, there's actually a crack going right up to the knee joint. It's just not going to come together. Full-on shattered, unfortunately. There's actually a crack going right up to the knee joint. It's just not going to come together.
At his Isleworth practice, Scott has discovered the break in guinea pig Oreo's leg is far worse than first thought.
I'll just try and put a wire around it first and just see if I can give it some stability, but I'm not holding out much hope for this.
If the nasty break can't be fixed, then the only option is amputation.
That bit of tissue I need to get out of the way, so can you just try and just here. And it's just collapsed now. It's just not going to work. I mean, that's just flapping in the breeze there. There's a huge amount of instability in that part of the thigh bone, and unfortunately, I'm just not going to be able to pin it back together because it's just splaying apart. Like someone's got an axe and cut it in two long ways. Unfortunately, it does mean we're going to have to amputate little Oreo's leg, which is very gutting, isn't it? Most animals do pretty well on 3 legs. Oreo doesn't have to escape from predators. He can just sit in a little girl's bedroom and be loved.
Oreo's owner, Joanna, and her dad, Jeremy, have been waiting by the phone for any news.
It's not such great news, I'm afraid. Oreo's leg is fractured, and the fracture has actually got a crack in it, which is going all the way down to the knee. So unfortunately, what we're going to have to do is to amputate his leg.
Well, that is, I guess, the best solution.
You know, I think that it's certainly something that we should, give him the chance.
Yeah, okay, and it's just one of those things.
Okay, Jeremy, well, look, I'm going to crack on and finish this procedure, and then we'll wake your boy up. I'm sorry I've had to deliver that news to you.
All the best.
Okay, cheers. Bye-bye. It's tough to call an owner mid-surgery, but in this case, unfortunately, this is the only way to go. Obviously, I'm very disappointed to be Oreo's vet and not be able to get the perfect result, which is to send him home with all 4 legs intact. But guinea pigs are very resilient little creatures, and performing the amputation doesn't mean the end of his life. It literally means the start of a new one. He will have 3 legs, but he will be out of pain. Let's wake this boy up, shall we? He's off already. Good boy. Come on, let's go. Good boy.
Oreo will sleep off the anaesthetic before heading home later today.
There you go. Mummy will be back to pick you up very soon. Yes, she will. Yeah.
Come on, Pixie. Get that eye sorted out.
In St Margaret's,
Good
Katie
girl.
and 9-month-old rescue dog Pixie have arrived to see Scott.
Good girl.
Hello, Katie. How are
Hiya,
you? I'm
pleased to
Scott.
meet you.
Nice to meet you.
Nice to meet you.
This must be Pixie. Hello, you. Oh, hello. Oh, that's
Apologise.
quite over familiar straight off the bat, isn't it? Hello. Hello.
She does love her cuddles.
Oh, even with a vet.
Ooh, well, I think I see what the problem might be. All right then, shall we come into the consult room?
Hey, you're going to give me a cuddle?
She will,
Oh,
she'll give you proper cuddles.
little Pixie, the little scruffy fur ball. Straight away, she gives me a hug, which is just absolutely adorable. 2 fluffy paws right around my neck. Loved it. This eye, Katie, tell me all about it.
So she got attacked by 5 dogs when she was a very, very tiny puppy. And the actual eye ball came out of the socket. So it was put back in with help of my mum and the veterinary nurse, my mum.
So no, let's stop you there, Katie. Her eye popped out of her head.
Yeah.
So she got attacked by 5 dogs.
Yeah.
And then so I came
Right
popping
out,
out.
yeah.
And then your mum leapt to the rescue.
Grabbed her, put a towel over her face, and they then took her to the vets.
But you don't seem particularly traumatised by the whole thing, do you? It really makes me feel desperately sad to think that poor little Pixie at just 5 weeks of age, being set upon by 5 dogs and potentially suffering a lifelong injury. I believe she is a beautiful, special little creature that deserves a lot of love and a lot of treatment. That's exactly what I'm going to do. Let's have a little look underneath that unbelievable fringe you've got going on, haven't you? If you just hold around the shoulders for me, Katie, there. Let me have a look. I know your eyes had more attention than it ever needs, but oh my goodness. Looking at Pixie's eye, you can see, unfortunately, that it is what we call an end-stage eye. It's very small. There's a cataract that's formed within it. So unfortunately, the left eye is completely blind. Good girl. Let me have a look at this one.
No, baby.
Okay, let's see. Good girl. Does it always flick like that?
Yeah. And when she goes into somewhere that she doesn't know, she does circles, she bumps into things, and the perception isn't great. So worried about the other eye as well.
Yeah, for good reason. That is relentless flicking. Looking into the right eye, I was quite hopeful that this would be a functional, happy, healthy eye that was completely normal. Unfortunately, it isn't. So I just wouldn't mind plunging us into darkness for a second. Can you just turn the light off? So let's see. Good girl. So the back of the eye, the retina looks absolutely normal. There doesn't seem to be any issue going on with the eye. The concern I have is Now, two things. First of all, that flicking, which is called nystagmus, which does tend to indicate some sort of neurological injury, but also her pupil is only barely responsive to light. It's really upsetting and shocking to see you've got a left eye that's non-functional, and I hope that that would be my focus, but instead, I'm more worried about the right eye. That's the only eye this poor little dog has left, the only eye that's functional, but unfortunately, it's not functioning very well. Can we just pop her on the ground and just have a look and see what she does? I just want to see how she behaves on the floor.
Come on, Pixie.
Oh, wow.
If she's in my flat, she's fine. She knows where things are. But if it's a new environment, that's when we have the problems.
Okay. That's not normal.
No.
It's really distressing to see the clinical symptoms that little Pixie's showing. She's a young dog. She's already been through a massive trauma with her eye. And now it seems she has this neurological issue. It's very sad. My advice here is that we send you to a specialist ophthalmologist who is a vet that knows lots about eyes, and they'll have a good look at Pixie and work out what, if anything, we can do, because it may well be that eventually you're looking after a blind dog.
Yeah.
A very beautiful blind dog, however.
It was very shocking. Wasn't expecting it, but she's a fighter. She's fought this hard for this long, so at least we can move forward in the right direction.
You know, as tragic as this is, the one benefit of youth is that she just goes, well, you know, I barely remember seeing, so actually I just get on with it. I love my new family, you know, and I'm going to make the best of it.
Good.
Pixie will be given medication to help with the nausea caused by all the circling. And Scott is going to arrange the specialist appointment.
She's beautiful. Yes, you are.
In Richmond, 4-year-old French bulldog Winston is coming in with his owner, Cara.
Hi, Cara.
Hi.
Hi. Hi, Winston. Hello, champ.
Winston is a popular visitor to the clinic.
Ah, there he is.
Especially with receptionist Kirsty.
How's he doing?
So he's got a bit of an embarrassing problem.
Oh dear.
You might want to have a look at. It's not very nice.
Oh.
You're not looking very embarrassed, are you?
No.
Perfectly
Looking
fine.
gorgeous as always.
Yeah. All right, well, if you've got an embarrassing problem, we should probably go in private and talk about it, shouldn't we? Come on then. All right, you got him, Cara?
Yep.
That's it. Good boy.
He's kind of everything, really. He makes us laugh every day, and he's very popular, and he's very sociable and quite outgoing. And yeah, I love him to death.
So first things first, young man, embarrassing issue. I'm guessing it's the back end somewhere?
No, actually, if you get a bit closer to his face, I think you'll probably smell the problem.
Oof. Oof, my boy. Oof. Someone needs to brush his teeth. That is horrific. How long has that been going on for? Shocking breath.
It's been going on a few weeks now, and I've noticed some lumps in his mouth that's getting worse. So I just thought it'd be good to have you to have a look at it.
Yeah, okay. Can I have a little look in your mouth, my boy? Whoa! Whoa! Oh my God, that is horrific, isn't it? Wow, it's like his whole mouth has been taken over by barnacles.
Yeah, because he's got the bulldog chops. Until we pulled them back and had a look, we just didn't realise.
And they're even on this side too. Look at that. Oh my God.
I've never seen anything like it in my life.
Body.
When the vet says, wow, it must be pretty bad.
So basically what this is it's the papillomavirus, so the wart virus that people have.
Yep.
Dogs can get it as well. And generally, it's only 1 or 2. You know, you might get maybe 5.
Yeah.
And after a few weeks, it generally regresses, they fall off and it goes away. How long has this been going on for?
About 6 weeks.
Oh, buddy. And he's such a tough little dog, this guy, so he wouldn't give much away, but when you open his mouth, I mean, that is so unbelievable, because one of those is actually just going right between his molars, which should just be so uncomfortable. It's not that unusual for young dogs to have warts develop, and they come and then they go. But this case is extreme and incredibly unique. For a dog to have that many warts present in his mouth, it's nothing I've seen in the last 20 years. We are going to have to perform a procedure on you, my friend, to try and debulk, try and remove some of them, and then use some medications to dampen down the continued regrowth of more,
Yeah.
I think the best thing for us to do is to have him in today, give him an anaesthetic,
Okay.
and then harvest, if you will, these barnacles out of his mouth.
Yeah.
And start giving him the comfort that he deserves.
Yeah. No, that's great. Thank you very much.
All right, then. Well, do you want to say goodbye to Mummy? I probably wouldn't give her a kiss, though, because with that breath, she won't thank you for it.
See you later.
Okay, then, Carol. We'll give you a call once he's woken up.
Thanks very much.
All right,
Thanks, Scott.
see ya.
Cheers. Bye-bye.
Bye.
It's never nice. You never want your dogs to go under general anaesthetic, especially the bulldogs who can have problems with their breathing as it is. And I'm hoping that he's going to be all right. He's in good hands. And I'd be devastated if anything happened to him.
So now we're going to sort them out. Yes. We use a special bit of equipment. Yes, we are. You ready for this?
Go on then. Wow. Okay.
I've just never seen anything like it.
No, I mean, I've seen one or two, yeah, but that's like a colony.
Nathan's an experienced nurse, has seen a lot, and together we've worked on many cases, but we're both quite shocked by how severe Winston's wart problem is. I am going to be removing these warts by using electrocautery, so basically a pen that cuts and then coagulates the blood at the same time. So hopefully going to be removing these warts like a hot knife through butter, but it's going to take a while.
As well as making Winston much more comfortable, the surgery will also help kickstart his immune system to fight off the wart virus.
It's actually horrible, isn't it? Gross. Poor boy. You can just imagine like how many of those are in between the top and the bottom teeth. So every time he chewed, he would have been biting on his own face. What a brave soldier he's been.
The warts are coming away easily, but there are so many of them, it's going to be a slow process.
Slowly getting there, but it's unbelievable. I've never seen anything like it. Never seen anything like it.
In Richmond, Scott is treating a shocking infestation of warts inside French Bulldog Winston's mouth. While the condition is not life-threatening, it's likely at some stage Winston's immune system was weakened, allowing the warts to multiply at an alarming rate.
Let's just make sure we've completely cleared out this side. So can you put pressure on that? So you need to use your fingers to push it down halfway.
And Scott is shocked at how far the horrible growths have spread.
Some warts have gone so far down his throat, they're actually hanging into his airway. They're present in his soft palate, which is at the back of your mouth, and these warts are then going right into his larynx as a voice box. Nasty. Done. I'm really happy with that. It looks horrible now, but it will look a lot better soon. It's been a really long procedure, way longer than I thought because of just how many there were and how extensively they had spread. So he'll take a little while to recover, but actually I think he's going to feel a hell of a lot better than when he first went under. So it's a good result.
Winston will be started on medication to make sure the warts don't grow back.
I know. Oh, poor boy. Oh, no.
For now, it's time to sleep off the anaesthetic.
It's all right. I'll go and call your mummy. Good boy.
Come on then, let's go in.
In Isleworth, owner Joanna and her dad Jeremy are back to pick up Guineapig Oreo.
Hi,
Hey,
guys. How you doing? Hello, Joanna. You all right?
Yeah.
Yeah. So Daddy's told you what's happened today, hasn't he?
Yeah.
Yeah. How are you feeling about that?
Glad he's okay.
Yeah. Well, I think you're being very brave. So I just want to warn you, okay? Obviously, he's lost his leg, all right? What you got to remember is that animals aren't hypochondriacs, so he's not going to complain to you that he doesn't have a leg. He just wants lots of love and cuddles, all right? So here he is here. Where's Mummy? There he is. Wow. So let me show him to you. There you go.
What are those metal bits?
So they're called staples, and they're going to hold the skin together. And there's lots of stitches underneath to keep it all together. And in the meantime, he needs lots of love and he will be able to move around. He just needs to get used to walking on 3 legs rather than on 4.
Yeah, I'm really excited to get him home and just cuddle him.
The staples come out in about 10 days. See, look, you can see him moving around there already. See, you're having a little run around. That's good. Oreo seems to be making a great recovery. He's already moving around the table, so he definitely seems to be back to his old tricks. All right then, Joanna, you give him a lovely cuddle. All right. There you go. All right, you look after your boy for me, and I'll see you very soon. All right?
What'd you say, Joanna?
Thank you.
You're very welcome.
Thank you.
Later.
Thank you,
All the
Scott.
best.
All the best.
No
Cheers.
worries. Bye, guys.
I think Joanna's been very brave and said, well, you know, if he hasn't got it, then he can't feel the pain. And, and that makes sense. So, yeah, we're very pleased with the outcome. Let's go. You okay?
Over in Richmond, Winston's owner Cara has also arrived to take her French bulldog home.
I'm really looking forward to seeing him, actually. Hopefully he's not going to get too excited. I don't know how sleepy he's going to be, but it'll be lovely to see him, and he's normally super excited even when I've been away for 5 minutes, so I'm sure he thinks I've left him forever.
Hello.
Hi, buddy. Hi.
So what's the first thing you notice?
The smell's gone.
Exactly.
That's for sure. My
No
God.
smell. Woke up with lovely fresh breath, didn't you?
He'll be a lot more comfortable.
Yeah, absolutely. Look, let me pass him to you.
Yeah.
Let me show you some of my handiwork. So they were absolutely surrounding, smothering the insides of his cheeks. They're under his tongue, they're on his hard palate, and then also on his soft palate. You can see the difference.
Oh my God, it looks so much better. Oh, good boy.
There you can see a little bit of healing to do, of course. It was a thoroughly disgusting process, but I'm really glad all those warts have gone and he should make a full recovery and feel a lot more comfortable. Do you want to see them?
Definitely, I definitely want to see them.
They're totally disgusting.
Oh my God, looks like something from the bottom of the ocean.
It really does. So I was thinking
it's
that looks like
horrific.
barnacles, doesn't it?
And all that in his tiny little mouth.
Yeah.
Absolutely shocked by how many were in his mouth. We knew there was quite a lot, but I'm pleased they're now in a dish and not in his mouth anymore.
All right, buddy, you sleep it off, eh? Better out than in? Yeah. All right, good boy. All right, Cara, all the best.
Thanks ever so much.
See you
Scott.
later.
Thank you. Take care. Bye-bye. Bye, Kirsty.
Pick, come on. Hey, good girl. You're going to go with Scotty today.
In West Sussex, it's now the day of Pixie's eye specialist appointment.
Good girl.
But there's been a family emergency, with owner Katie going into labour.
You scallywag.
So her mum Daphne is looking after the little dog. And Scott has stepped in to handle the specialist visit.
I know that's the farm dogs, but you don't need to bark.
Hi there, you must be Daphne.
Hi, how
Hi,
are
I'm
you?
Scott. How are you?
Hello, good morning.
Hello, Pixie. Good to see you again, beautiful.
Oh, gosh, you do recognise him, yes.
Hello, baby girl. Speaking of babies, what a drama for you this morning.
no.
So Katie's in the hospital
She's
now.
in the hospital.
About to give birth at any minute. It's been a few weeks since I've seen little Pixie, and actually she's looking a lot better. She seems very bright, very happy and enjoying life. And I feel the anti-nausea medication that I prescribed has had a real impact on improving her quality of life. But she still has some very concerning neurological symptoms. The spinning and also the eye flicking seems to have maybe even got a little worse. So I'm really looking forward to taking it to the specialist today and understanding a little bit more her problems. Say bye to Grandma.
Bye, darling.
All right, we'll see you later, Daphne.
See you
Take
later.
care. Bye.
So terrific help Scott taking Pixie for her appointment, and then hopefully we'll know what to do after that.
That's a good girl. Here we go. Here we are. Let's go and see the eye doctor. Come on.
Ophthalmologist Rob Lowe is handling the consultation.
Hi there, Rob.
Hi, Scott. Lovely to meet you.
Nice to meet you as well.
Hello.
This
must be Pixie.
is your patient for the day. This is Pixie. She has quite a few fairly horrific injuries that she suffered in Italy, and unfortunately her sight is not great. So you're the man to see about that.
Well, hopefully so. Lovely. Well, if you'd like to come on through this way, we'll
Yes,
have a little
please.
look.
Great. Come on then.
Come
Let's
on then,
go.
Pixie. Good girl.
Good girl. I'm feeling a little bit of pressure right now because it is a first for me to be squiring a patient of mine through a specialist appointment, all the while the owner is trying to give birth in a hospital. So that's definitely a first for me. I just hope that I do a good job and that Pixie comes through it okay.
Let me have a little look at this eye. Well done. So just looking at hand movement towards the eye, as you appreciated, there's not much response to that hand movement, and yet she's quite capable of blinking when I touch the eyelids, which indicates that we've got a problem with the visual signal being sent up to the brain. So we're going to take a bright light and shine this into the eye now, and what we should see is a constriction of the pupil, and there should also be a blink response as well as the eye tries to protect itself from the external bright light. And we can see that there's no constriction of the pupil occurring, and there's no blink response, indicating we're lacking a dazzle response as well as a pupillary light reflex.
The tests done by Rob confirm Scott's suspicion that not only is Pixie blind in the damaged left eye, it appears she also has no vision in the right eye either.
Good girl.
Scott now wants to show Rob her strange circling behaviour.
It's a little like a whirling dervish. She just goes in circles, particularly when she's stressed.
So she's circulating round to the right the whole time. There's no signs of her actually being able to turn around to the left.
It would definitely suggest something more central. No, that's not just a simple eye problem.
No, there's something more going on.
Okay.
Having examined Pixie, we've found that she is unfortunately non-visual in her one remaining good eye, and we have certain signs such as the flicking of the eye from side to side and the circling, which suggests that this is a central nervous disease problem rather than a problem directly with the eye itself. Okay, little Pixie, you're going to come with me. We'll get you introduced to the anaesthetic team, get you anaesthetised and get your CT performed.
To work out what might be causing Pixie's behaviour, the little dog will now undergo a CT scan.
Great. All right, bye, beautiful.
Yeah, well done.
All right, see you on the other side.
See you in a little bit.
See you in a bit.
Thanks very much.
Taking a CT scan gives us a 3D image of the brain and the skull.
Good girl.
The biggest concern would be is if we were to find some sort of growth, and that would be absolutely devastating. So I don't know what we're hoping for, but we're definitely hoping not to see that.
Okay, let's just slide you back a little bit.
Assisting Rob with the CT scan is Nurse Emma.
Let's get you settled.
So under the CT scan, we're looking to see if there's any skull abnormalities and any asymmetry. We're also going to be using some contrast to highlight any vascular areas within the brain, which may indicate that there's a growth or something like that within the brain itself. Okay, oxygen's on.
Okay.
Okay, we're connected up.
Sending through, okay.
Okay. I just hope that this isn't going to be an ongoing deteriorating problem for her, and that's my big concern at this stage.
We're looking nice and straight there. Sending through, okay.
Okay.
In Hampshire, Pixie's undergoing a CT scan to shed some light on the damage caused by the vicious dog attack, which has left her with failing eyesight and odd circling behaviour.
How are you getting on?
Yes, well, we've got some great images through. Really now we just need to work out what's happened. So we've had a look at the skull, and if we do a cutaway of this 3D model here, as we look at this also in cross-section, we can see here that what should be a nice, bony, hard palate running in a straight line, pretty much back to this area and then forming the base of the skull. So lots of gaps within there, and it looks like it's been displaced up towards the brain as well. And then we've also got this advancement of bony-like material into the brain cavity itself. So there are a number of processes going on here which may well start to explain why we're seeing these neurological changes with Pixie.
So it seems like this dog has been bitten and that skull has been crushed.
Yeah, that's what we're seeing. This is more of a crush injury rather than a straightforward fracture, and that's pushed bits of bone in where it shouldn't go, and that's what's probably causing these brain injuries.
Does it surprise you that she's still alive?
Not only is she alive, but she's a happy little dog.
Yeah.
And that's just testament to how well dogs cope with adversity like that. Her eyesight isn't going to get any worse because, unfortunately, there is no eyesight left anyway, so she's not going to miss that any further. And in fact, what will happen is over the next couple of months, she'll spend quite a lot of time adapting further to that loss of eyesight. And that's what Pixie has hopefully got to look forward to, is that adaptation and getting back to a semblance of her normal life.
Come on, sweetheart. Good girl. Let's see it. Oh, poor baby.
While Pixie's blindness and brain damage can't be reversed, Scott's optimistic that a care plan can be worked out with her family that will give her a good quality of life.
This little girl is such a fighter. She's woken up quickly from anaesthetic. she's no worse for wear. And considering the extent of her injuries and just how catastrophic those changes are, what a plucky, strong little girl. So proud of her. So brave. Good girl. You have a little rest. Eh?
2 hours later, Pixie has slept off the anaesthetic and Scott is returning her to Daphne.
He's a good boy. Who's this coming?
Hi, Daphne.
Hi.
Look who I've got.
Oh, Piggy. Picky Wicky.
Here she is.
There she is. There's a little girl. Hello. There you go, Toby. I told you she'd be back soon.
She's been such a good girl today.
She
She's
is a
really
good girl.
done you proud.
She's
Yeah.
a very sweet little dog.
She's not only very sweet, but incredibly brave.
Yeah.
Certainly the images that I saw today were horrific. The trauma that she sustained from that bite really was beyond unimaginable.
Really?
Yeah. But there is some good news because the fact is, you just wouldn't believe that's the same dog that has suffered this terrible trauma. She was lucky enough that this happened early in life and she has developed through it.
Yeah.
She's never known a life any different from what she's living right now. The only issue that I have that we need to address with regards to your family is this. You feel that she gets worse when she's in a new environment, in a new situation.
Yeah.
I actually believe that it's anything that stresses her, anything that's different, change, all those things lead to that
spinning.
repetitive spinning, which is not in her best interest.
No.
On the drive back from the ophthalmologist to Daphne's house, I was deep in thought. I just was really trying to work out what's the best thing for Pixie. And coming back and being in this beautiful warm room and seeing the lovely Daphne snuggled up with little Toby, I knew what the answer was. Katie loves this dog and I know that. But she's just about to have a new baby.
I know.
She already has children.
Yep.
And ultimately, where is the best place for this little dog? Is it with Katie and her growing family? Or is it with Grandma, who is quiet and comfortable with a loving dog beside her, sitting beside a beautiful roaring fire? Daphne is an ex-ward sister, so she's very adept at looking after patients with complicated issues. And so I couldn't think of a more perfect owner for Pixie than that. She lives in a lovely environment. So really to have someone one-on-one focus on Pixie's best interests, I think is the perfect world for her.
She needs Toby as well for stability.
She's following Toby because she can smell Toby.
She smells Toby.
And to have a canine companion that can help her navigate this world, now we know that her vision is gone, is so important.
Yeah, I know.
And to have small children and babies and the noise and everything that comes with that, I just don't think it's the right thing for Pixie. And I think, despite how heartbreaking that might be for Katie, I actually think she wants what's best for this little dog. And I feel the best thing for Pixie is being with Grandma.
Yeah. She's going to have the best life she possibly can. We're going to take her out and show her the countryside. Oh, yeah, she's going to have a good life. Who's this baby? Who's that?
Here we go.
5 weeks after his operation, Guineapig Oreo is back with Joanna and Mum Rachel for a checkup.
Hi, Rachel. Hi, Joanne. How are you?
We've brought you Oreo back for his checkup. He's doing really well.
Yeah?
But it'd be good to know what you think.
Hello there. Now, this is the first time that I've met Captain Scott. He's quite considerably larger than his brother, isn't he?
He is. They started off the same. So
Nice.
it's hard to believe, really. But yes, he's thrived on us trying to get Oreo stronger.
Let's have a look. Hello, little man. How are you? It's amazing with the fur growing back. You really just can't tell that he's an animal with 3 legs.
No, and especially when he moves around, he's really good. You know, you wouldn't think he's being held back by the fact he's got 3 legs.
He's doing great. He seems very bright. So I think as far as, amputated stumps go, it looks pretty good. Joanna, are you happy?
Yes.
Yeah?
Joanna's delighted with how well Oreo's doing. I think it's better than we could have all expected. And all her friends love to come round and to see him running around and doing really well and giving him treats. So I think it's been lovely.
And is he getting around okay? Is he walking around and chasing his brother?
I think it's the other way around. His brother's chasing him.
Oh, is that right?
He can put on a real spurt of speed.
Can he?
Yes, he can.
I'm very intrigued to find out because I'm very happy with the way he's gone. And my little namesake there, yes, he's a little podgy, so he could do with some exercise.
Yes, he definitely could.
So we've actually got this guinea pig exercise track. So we thought that we'd put these guys to the test and just show that just because you've got 3 legs, you can still beat your podgy brother in a race.
Come on, Oreo. Let's see what you can do. I think it'll be really interesting because on a good day, Oreo could take captain, I think. So it'll be really good to see if he can perform today for us.
All right, well, should we put them in their little avenues?
All right.
Okay.
Come on, captain.
Okay. How do you get them moving normally at home? How do you get them excited?
Oh, captain. You know it, don't you?
A little bit of rustling, getting them excited. Okay, well, you keep rustling. Come on, Oreo. Get on your marks. Get set. Go. Come on, Oreo. Come on, Oreo. Look. Look.
You're a bit nervous, aren't you? What's happening?
Come on. This way. Come on. You're showing me up. Putting Captain Scott and Oreo in the guinea pig run and then releasing the beasts, they seem disinterested totally. They're barely moving, but I think it's just because they're a little bit nervous. Maybe they have a little bit of stage fright, but either way, I can see them moving a little bit, and certainly Oreo is doing really well. What's that? Oh, we're teasing him up the avenue. No cheating. Come on, good boy. Let's see you moving. Good boy. That's it. Keep coming, keep coming. I don't feel that guinea pig racing will be a spectator sport somehow.
It's a little,
yeah, a little dull.
Passive.
Yeah. The fact that he's moving, really well, he seems very comfortable, seems very happy, he's eating well, so I'm a happy vet.
Yeah.
Hey, come on, your rotund brother is beating you. Come on, come on.
We've definitely got a winner.
Yay!
Oh, Oreo gets it.
Yay! My vet clinic, my rules.
Yeah.
Okay.
6 weeks later, and there's good news all round from Pixie's family.
Hannah, Pixie likes flowers.
Does she?
Katie delivered a healthy boy named Harry, and her little rescue dog Pixie is now enjoying a much quieter life with Katie's mum, Daphne.
Picky, come. Picky, come. Good girl.
Pixie's doing really well now. She's not spinning as badly as she was. She's putting on weight. She's developing into a lovely little dog, which is wonderful.
It's also Pixie's first birthday,
Well,
and
this is a
Scott has stopped by
family
to help
scene,
celebrate.
isn't it?
Hello.
Hello, guys. Hello,
How are you?
Katie.
How are you?
Good. Mwah. Congratulations. Here's this little man.
This is Harry.
Hello, Harry. Aren't you gorgeous? Hi, kids. Hello, Daffers. How are you, darling?
I'm fine.
You
thank
all right?
you. Yeah.
Mwah. Good to see
And
you.
you. Hello, baby.
Hello. Toby. Hello, mates. Thank you very much. And the birthday girl. Hi. Hi, 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 hi. Today is an unbelievably special day because this gorgeous little dog who's had such a harrowing existence so far has made it. It's her first birthday. Well, Mummy really does well and truly have her hands full.
Yes.
So Pixie coming to stay here with Grandma in this gorgeous environment.
It's the right decision for her, and it's the right decision for us as well. Although we do miss her, we miss her terribly, don't we, Bobby?
That's the tough thing about being a dog owner, isn't it? It's just
Yeah.
like being a parent, you have to put them first, and the best thing
Exactly.
was for her to be here.
She fits in. She's just a member of our family. Doesn't matter if she lives with me, doesn't matter if she lives with my mum. She's a member of our family, and that's all that there is to it.
All right, well, I'd like to see this little princess in motion. Hey, should we see what you like taking for a little walk? Hey,
She
a
loves
little walk? Does she? Well, let's have a look, shall we? Pixie, come. Hey, look. Well, that's awesome. Good girl. Pixie's case has been different from the usual. I haven't been able to pick up a scalpel and fix the dog. I'd say if I was walking in a park with a dog like this, I don't think people would know she was blind. Instead, this has been a case of support and of care, looking after a family and helping them through a tough time. And it's wonderful to have a day like this where we can all sit together, joyful and happy with the dogs that we love. It's very special indeed. Well, a birthday party isn't a birthday party without some presents, is it? What's in here? Look, this is for you.
Wow.
This is for you. Yeah?
And this is for your little brother. There we go.
Oh, it had to be doggy.
Yeah, no, thank you so much.
There you go.
Thank you.
There you go, little Harry. It's as big as him.
It is. There you go.
And this is for you, my little princess.
Okay. Happy birthday, baby.
Here's to many more to come. All right.
Ah, you guys been on a house call together?
Sort of.
Something like that.
In Richmond, Scott's practice manager Maz and nurse Jess have found an unusual patient, a wild fox.
Just a bit special.
So we got a phone call from a woman's housekeeper, basically saying that there was a fox trap between the bars on their basement window and the window itself.
Ooh.
And he must have hurt himself because he couldn't climb up, so I'm guessing he slipped. But there's just blood everywhere, bless him, so I think he must have a cut in his paw or something somewhere.
Okay. Well, he definitely needs some veterinary care, so let's go.
I'm right behind you. Obviously, we're all a bit nervous as to what injury the fox has got. We're hoping it's nothing too bad, but obviously until Scott has a look, we're not going to know for sure.
Maz, if you can gently lift the top off at the same time as I'm going to just sneak my hand in and just try and pin him. And then, Jess, if you can put the muzzle on. And, of course, we're going to be putting it on upside down because they're nocturnal animals. If you cover over their eyes, then they just feel a bit more at peace at the same time as closing together the gnashes.
Yeah.
So none of us get bitten. So
I like the sound of that.
Yeah.
all right.
Just if you can sort of lean it that way so I can just get my hand in.
Nice.
Nicely done.
Okay.
Hello, beautiful. All right.
It's all right, it's
all
honey.
right. It's okay. It's all right.
Port City foxes do get quite a bad rap because they make a lot of noise at night time. They break into people's garbage bins. But to have a wild animal in the practice is not something that we see every day. So when we do, it's really exciting.
Being so brave.
He is quite young to be out and about on his own. Unless Mum's waiting for him somewhere.
I hope she is, and I hope we can get him back to her.
Yeah.
Jess and Maz informed me that at the scene there was quite a bit of blood. It was carnage, so there must be some bleeding somewhere on this little fox's body. I just need to find it.
Yeah, it looks like a bite wound. So it's been attacked by something, either a bigger fox or a dog or something. But so that's a bit of an abscess there. Whether it contributed to it, I don't know, but it's definitely a bite wound rather than a fall injury, that one. So there's another wound there. Oh, ouch.
Oh, poor thing.
Oh, you've really been nailed by something. Look at that. That's a big, nasty hole. Oh, champ. Yeah, gonna be sore. Yeah, I think this guy's strayed into a backyard and a neighborhood dog has got him. Because it's just, look at the size of that. That's you can see the size of his canines.
Right.
See that they're quite long and narrow, and yet that hole is quite significant. So I'd suggest that's a canine of, a bigger dog, like a Labrador or something like that. Oh, poor boy. So that would hurt a lot. Okay, so I'm just going to check each of his limbs just to make sure I'm not missing any fractures or anything as a result of the fall.
Yeah, so
All right,
good.
sweetheart. Good boy.
I say boy, I haven't looked yet.
Yeah.
Oh, actually, so in fact, it's a little girl. It's a female.
Sorry, love.
Yeah.
Yep.
It's all right. You've definitely worn down those nails getting up that wall.
So the same injury is present in both feet, and that's where I think the fresh bloods come from. She's been scrabbling away where she was caught between the wall and the window, has basically ripped the ends of her nails off, and there's been quite a bit of bleeding from them because the nails have a good blood supply and they'll bleed very easily, particularly when an animal is stressed, and certainly this young fox would have been when she was caught down the side of this building. Really, I think that we can just give her a bit of medication, and being a wild animal, the best place for her is back in the wild. So we'll give her some treatment and then release her, and hopefully, if we release her right near the house that she was found, then she might maybe find Mum.
I hope so.
Okay. All right, so we'll just give some antibiotics first.
Well done.
Okay, just give you a little bit of pain relief as well. Okay, all right.
Good girl.
Okay, so let's just do a little bit of cleaning of that wound. So look, you can see it popping out the other side there.
It's a full-on hole.
Yeah, it's a bit from one side to the other, so she's been very much chomped.
That's what I mean.
Now that this fox is all patched up, there's no reason that we need to keep her any longer, and the less time that she's separated from any family members, the better for her. Pretty special, isn't it?
Yeah.
Eh? Well done, you two.
Yeah, we did well.
Yeah.
Force to be reckoned with.
Yeah.
Well, considering you saved a girl, it's quite girl power, isn't it, really?
2 more members would be the Spice Girls.
Yeah, Ginger Spice.
Yes. Or maybe Jerry.
Yeah.
You be Baby Spice. If you say I'm scary, I swear to God.
Well, I'm just so glad you're saying I'm not posh. Foxes generally are solitary animals, but being that this girl is still quite young, I'm hopeful that Mum or Dad might be waiting for her in the park. So now that she's all patched up, let's set her free and hope that she'll be reunited with her family. 3, 2, 1, go. Well done, everyone.
Good girl.
Good girl.
So good.
All right, shall we go and release her?
Yes, let's.
Yes.
Let's do this.
Exciting.
Jake, do you want some lunch? What have I got?
In Sussex, retired nurse Beth is hoping Scott can help her beloved boy Jake.
You hungry boy?
Beth adopted the Shih Tzu cross 6 years ago as a rescue from the RSPCA.
My first impression of Jake was I thought he was gorgeous and I wanted to have him immediately. Go and eat up, darling. There's a good boy, eat it. The only thing I know about Jake's past is that he was inbred, but his legs were not too bad at that stage.
Jake's bowed legs are a defect that he's had since birth, but recently, Beth has noticed him struggling more and more.
His legs were bent, but he did not seem to be in a lot of pain when we first got him, because he was walking a long way. I could walk the best part of a mile with him. Come on then. And nowadays, just walking up the road seems to really wear him out. Let's get home. Good boy. Jake isn't managing very well at all. When he comes off the settee at night, he almost stumbles off. 9 times out of 10, I pick him up and put him down, and he's very wobbly on his legs. He's such a playful little dog. It just breaks my heart to see him like that. I wrote to Scott in the hope that he can actually help sort Jake's legs out and get him out of pain for me.
Jake is booked in with Scott tomorrow.
I just want him mended, and I'm sure Scott can help get that sorted for me.
Come on then, you.
Let's take you home.
Yeah, it's very exciting.
In Richmond, it's time for the rescued fox cub, affectionately named Jerry, to be released back into the wild.
Look, she's so excited.
You know where you are?
Are you home?
Yeah.
Oh, love her.
She's really looking around,
Oh,
isn't
I
she?
hope you find everyone. So Jess and I wanted to try and get Jerry back home. Obviously, we don't know where that is, unfortunately, so we've gone for the park just opposite where we found her and hoping that she'll be able to find her way home from there.
He looks good, don't
Yeah,
you
I think this would be good.
She looks like she knows the place.
Oh, what do you reckon?
I'm so excited.
Hopefully your mum and siblings are around here somewhere. We've only spent a short time with Jerry, but it's just amazing to be up close and personal with a wild animal, and she is beautiful. And to know that you've actually helped her is just amazing. It's a real privilege.
Okay, are you ready to go home?
Ready?
Go on then. Oh, there she goes.
Yay, go on. Go on, I've got to be around there somewhere.
She's having a good look.
She is, isn't she? Oh, that's so cool. She really does know where she is.
Off she goes.
Bye, Jerry.
Yeah.
Bye, Ginger.
Little cutie.
Well, there we go. Job done. Get back to it, shall we?
Yeah. Oh, that's so nice.
That's lovely.
Having watched the show, I wondered if you could give me some advice on how to get my dog out of pain. You can see from the photos, his front legs are very crooked. Gee, wow. See that sort of heart shape going on in between his...
Totally bent inwards, aren't they?
Yeah.
At his practice, Scott is waiting for the arrival of Beth and little bow-legged Jake.
Please, can you help me? Of course we can.
Absolutely.
Look forward to seeing him coming in, and we'll see what we can do about this poor boy's legs.
Come on.
Hello there.
Hello.
How are you? Welcome to Richmond. Mwah. Mwah. Good to see you.
Thank you very much. Nice seeing you.
Yes, hello, and you must be Jake. Hello, champ. Hello, you've got a beautiful face. I'm not a big fan of those legs, though.
Jake walks a little bit like a sort of silverback walks through the jungle, elbows out and wrists close together. He clearly is a very abnormally put together dog.
Over the last 6 months, it has got a lot worse.
And is one leg worse than the other, in your opinion?
I think the right leg is the worst.
Okay.
But they're both very bad, as you can obviously see from the way he walks.
I just want to have a little feel.
He will not like that.
You don't like your legs being played with, is that
Does not
right?
like his legs being touched at all.
I'm just checking all of his joints here, Beth, and I think I'm pretty sure that it's going to be discomfort in his elbows. Yeah, there's lots of kind of clicking and grinding going on, and he's just unimpressed about me playing with it, aren't you, champ? Hey, even though you're a very affable boy.
Okay.
And you know what? This is a happy, friendly, personable dog. So that's not a life for him to lead, is it?
No, I mean, when I first got him, we were going out 3-4 times a day. And now even to get him out once a week is really must-do.
He's clearly got some issues, which is why you're here with me.
Yes.
I'm going to sort you out. Okay, good boy.
Downstairs at his Richmond practice, Scott and Nurse Jess are anaesthetising Jake so they can x-ray his legs.
Right, so do you want to take him through, Jess? Okay.
Come on, mate.
So, giving Jake a sedation allows me not only to have him still for x-rays, but just to examine him a little bit better. He really has the most awkward shape forelimbs, and the best way to see those better is with an x-ray. X-ray. Ooh, that's pretty shocking to look at. Poor Jake. Not looking good. Hello.
Oh, hello.
He's your boy.
Oh.
You want to sit with Mummy?
He looks very sleepy, boy. I love Jake so much. He's my companion. Love him loads. Best thing that happened to me. I just want him out of pain.
Do you want to have a look at some of the pictures?
Yes, please.
Be prepared for this. This is your dog's leg. And just shows how much he's been suffering.
That is terrible.
He's just showing what a brave boy he's been all these years, eh?
Never realised it was that bad.
Jake has a condition known as antebrachial growth deformity. This condition can manifest in lots of different ways, but for this boy, because both limbs are the same, my guess is that at some point the growth plate, which is the part of the bone which allows bones to elongate, has fused on just one of the bones. The other bone in the forelimb continues to grow, and so that leads to a sort of banana-shaped limb.
Oh,
And also,
that is really bad.
Beth, we need to remind ourselves that you didn't breed this dog.
Yeah.
You just rescued him, yeah? So he's lucky he's with you.
Yes.
The cause of this particular condition, unfortunately, is genetic. This is not a dog that's come from good stock. His parents, at least one of them, would have had these same angular deformities, which would have led to that dog having discomfort in middle age. But instead of going, you know what, that's not a great dog to breed from, they bred it anyway, and now Jake's here with the same problem, and that's just ignorant.
I'm absolutely gobsmacked at how he's stood the pain. It's a very brave little dog.
These joints have been through a lot of deterioration for a long time. And unfortunately, right now, it's just got too much for him. And so he's gone from being extremely brave and coping to not coping.
It's just shocking. I feel like crying my eyes out for him.
The key here is to get the best advice we possibly can get you. And that's going to a specialist, because you can see that this is a fairly special case. I'm going to send him to my mate Michael Hamilton, who's a specialist orthopaedic surgeon, who will hopefully get to grips with Jake and try and make his problem a little better. I don't need to do any more walking, so shall we have a little cuddle and walk out with Mummy? Shall we? Eh? Good boy.
I feel that now I've seen Scott, that we're going to be getting somewhere, and hopefully Jake will be out of pain relatively soon.
Come on then, you big baby, eh?
Are you going to show me that you deserve it? Are you going to say hello to me? High five, yes. Here's Daddy's baby.
In Kew Bridge, it's a nervous time for besotted owners Bobby and Mary.
Here you go. Good girl.
Their beloved 17-year-old Lucy is booked in with Scott for surgery to remove a nasty lump.
In 2014, we noticed that she developed a little bit of a lump on her backside. It was determined that it was a low-grade sarcoma. So she had the first surgery back then.
But the lump keeps growing back, and Lucy is now facing her third surgery to remove it.
It's always the same exact position.
It looks tiny from out
Yeah, it's kind of like a little bit like maybe smaller than an almond.
Now that she's 17, Lucy's constitution isn't as strong as a younger dog's, increasing her risk of not waking up from the anaesthetic.
Lucy is a senior citizen, so there's always the bit of risk, and of course we're a little bit concerned, but I think it came to the point where we got to do something about it. But I'm pretty confident that Scott, he's going to be able to take care of this, and we're going to make her all better.
Yep, we're going to make you all better.
Is
You
that
ready
right?
now? You ready
Is
for
that-
your walk?
Yeah. What do I got here? What do I got here? Uh-oh, don't get mad at me. That's my finger, actually.
You're such a piglet.
Bobby and Mary adopted the playful little bulldog Chihuahua cross 11 years ago when they were living in the United States.
Ready? Quick, quick. Good girl. Now we need your scarf. I don't know what I would do if I didn't have Lucy. She just gives me the company that I need. And whenever I'm not feeling good, I just curl up on the couch and I bring Lucy by my side and she makes me feel better.
So what do you think? It's not that bad of a day.
No.
That's pretty nice.
Come on, Mama, we're gonna sit
What is
for a
it,
little
Pumpkin?
bit.
You want to take a load off?
Lucy is booked in for the risky surgery tomorrow.
You're always debating yourself, and there is absolutely no doubt. You always want to make sure that you're making the best decision for your pet. Good girl. Of course, I'm still going to be a nervous Nelly, but I'm willing to do that because I think the longer-term solution for Lucy is we gotta have it taken care of, and of course, it's her well-being. You ready to go?
Good girl.
He's a good boy. It's okay.
Near Marlow in Buckinghamshire, Beth and Jake have arrived for their appointment with orthopaedic specialist Michael Hamilton.
Hello, Beth. How are you?
Hello.
Michael. Nice to meet you.
Hello,
How do you
Michael.
do?
Nice meeting you.
Hello, Jake.
This is Jake.
Right then.
So come on then.
Come on in, my little friend. Here we go.
Come on, darling. Since I saw Scott, Jake has deteriorated quite a lot. His walking is really bad, so I just need something done for him now.
It's interesting because he's got his feet straight, but it looks like his elbow is pointing out to the side.
Yes.
Right then, little man, let me have a little feel. Are you friendly enough? Watching Jake move around, he's got the very, very typical type of deformity that we see in these little dogs. If you just hold his head just there for me. Okay. As he's grown, one of the bones has prevented the other bone growing straight, and they have these very, very, very twisted legs. So I'm trying to hold his elbow here straight, like this, but with his elbow straight, his foot is probably 90 degrees rotated. Now, when he walks, he wants to put his foot flat on the floor. His elbow sticks out almost at 90 degrees. I mean, that is quite the bendy leg you have there. His left-hand side, that foot is flat on the floor, the elbow is twisted out, but it's not. He's managing on the left-hand side, isn't he?
Yes.
So the good news, a little bit of reassurance for you, Beth, is he's not painful at all on his wrist. I think his major problem is just the fait's that when he walks, it's buckling over on him. You know, it's more it's what we would call a mechanical lameness rather than an actual painful thing.
Okay.
So I think we should try and straighten his front right leg.
Yeah.
I think the left-hand side might actually be okay, to be honest with you. And the whole thing that we're aiming for here is to have an elbow that's lined up with the paw. Yes, we've got some good news for Beth, and there are some options to try and straighten this leg, but I won't celebrate until he's all fixed because it's complicated surgery. And if we do that, he's going to be able to walk on it, and hopefully we'll get a good outcome for you.
Yes. Michael doesn't reckon that Jake's in much pain at all and that he'll be able to operate. So I'm really, really happy about that. It's the best news ever. Bye, darling. You be good.
You gonna come with me? Straighten this leg? Let's do it.
Come on, Lucy.
Okay, little one.
Come on, let's go see Scott.
In Richmond, Bobby and Mary are bringing in their Chihuahua cross Lucy for an operation to remove a cancerous lump.
Here we are.
At 17, Lucy will be the oldest dog Scott's ever operated on. So she's at greater risk of potentially fatal breathing and heart problems under anaesthetic.
Hello, guys.
Hi, Scott.
Hi, Scott. How are you?
I'm good. How are
Nice
you?
to see you.
Good to see
How
you.
are you?
Hi.
Ah.
Good to see you.
And you. Hello, you.
Say hi, Scott.
Hi. Usual
I'm ready.
grumpy old lady.
Hey.
She's a bit edgy today, Scott. She didn't get any of her cookies, so she's waiting for the cookie fest later on.
All right. Well, let's get you in the consult room and we'll just chat through a few bits and pieces.
I'm a nervous Nelly, but I'm okay. I'm ready for Lucy to get this surgery done and over with and get Lucy back home.
So I'm just going to have a little look at this back and then just see where we are. Yeah. So even just from very recently when I last saw her, it's grown, it's got bigger, okay? And actually it's significantly larger when you sort of pressurize and press around it. It's quite big indeed. It actually goes from here all the way to here. So that said, the positives is that otherwise she's an incredibly healthy girl, isn't she?
Yeah.
We've done blood tests on her as well, and we've seen that her bloods are immaculate. There is nothing to suggest that she's 17 on those bloods, and age is just a number.
There you go. That's the right attitude.
Yeah, and as a result, we don't want to let something get in the way of her continued longevity.
Right. Yes.
Although I believe this tumour to be low grade, so low level malignant tumour, and that it should be unlikely to spread anywhere else in Lucy's body, it is now affecting her anus. Already you can see that the anus is sort of skewed to the left. The mass is developing on the right and pushing it and pressurising it. At some point she'll have issues with going to the toilet, and there's enough indignities growing old without
Absolutely.
Don't want her to do that.
being constipated as well.
Right.
But obviously it is still a risk.
I know a lot of people would consider a pet. I consider my pet my daughter. And so it's a very hard decision to try to understand what is absolutely the right thing to do to improve her life, giving her lots of longevity.
Nice and strong.
Good girl.
And slow and steady. Yeah, I have a sense it'll be slower than the heart that's probably lurked just here. Let's have a little listen. Yeah, I'll have to have the crash card out.
I believe so.
Yeah. I've got the paddles waiting for him, not for her. Hey, I've got to make them laugh, otherwise they'll cry.
I know.
You see, so that's what I'm doing.
Good girl.
That's great.
All right, you guys
Ready?
okay?
Yeah.
We're okay.
Ready.
You ready?
Ready.
We're ready.
Lucy is the oldest dog that I've ever performed surgery on. I don't undertake the surgery lightly, but the fact is that without doing this procedure, this lump eventually will cause Lucy to be constipated. She'll need more medication, she'll need consistent treatment, and that's not a good quality of life. So I really feel that the time is right to get in there, to grit our teeth, to hope for the best and remove this mass.
Scott has enlisted his most experienced nurses, Jess and Nathan, to assist with Lucy's procedure.
Okay, good. Her heart's strong. She's responded well to that pre-med, so she's a little bit dopey. We can take that off now, hey? During the induction process is when most amount of complications can occur because, unfortunately, they can respond badly to anaesthetic and things can go downhill very quickly. Okay, so everyone ready to go?
Yeah, all good.
All right, now, the key is waking up. Yes? Sleep, sweet dreams, sweetheart.
Yeah, all good.
In Richmond, Scott is about to start operating on 17-year-old Chihuahua Lucy, the oldest dog he's ever anaesthetized.
She's still quite light, but that's quite good. Okay, tubes in. 17 is a whopping age for any dog. But the fact is that without doing this procedure, this lump eventually will cause Lucy to be constipated. And she is otherwise incredibly healthy. We've done bloods on her, her heart is strong. So I really feel that the time is right to get in there and remove this mass. Jess, you're happy?
Yeah.
Okay, so it feels like we've just jumped through that first initial hurdle, so that's good. Luckily for us, Lucy starts breathing straight away. She seems quite comfortable under anaesthetic, and actually for all the concern and the worry that's built up regarding this dog, everything's going quite nicely. But let's not be complacent. So Jess, if you continue to focus on the anaesthetic, Nath, if you clip and prep her, and then I'll go and get ready. So far, so good. Thank goodness for Lucy's anaesthetic. She is responding quite well. We are managing it quite lightly, so just keeping her breathing, and Jess is stuck to her like glue, and I'm nervous. I'm just trying to scrub my nerves away and just get the best result for Bobby and Mary.
She's breathing really nicely.
Jess and Nathan will be closely monitoring Lucy's vital signs throughout the surgery.
Okay, everyone ready?
Yeah.
I'm just cutting now. I'm hoping that the tumour removal won't actually be too hard. I'm hoping it'll be a little bit like peas out of a pod. Once I've cut through the pod, I'll be able to pop out the peas. That's what's affecting the shape of Lucy's anus. In some ways, almost wants to fall out. But I'm just sort of encouraging it, but at the same time, I have to be so careful because there's some really important nerves in this area, and if I make one wrong move, I can make Lucy incontinent. So I have to just be methodical and very careful, but so far, so good. So that's the below the water surface iceberg. So you can see, so that was above and that was below.
With the tumour out, Scott will now try to remove as much of the surrounding tissue as possible to reduce the chance of the cancerous cells growing back.
There's a big crater here where those lumps have come out from, and then just seeing what I can remove from around the outside, because there will still be some cancer cells around. I know that I'm not going to be able to remove enough for cure, but Lucy is 17, so what I need to do is to put her out of immediate danger and give her last twilight years comfort. So flush, and we can close up. We're nearly there, things are looking good, but we don't want to tempt fate. So how are you guys feeling about everything?
Good, yeah. I
Yeah.
won't be able to breathe properly until she's awake, though, I think.
Yep. Last suture. So that's that.
Happy to turn off?
She can turn off. Okay, and let's watch her like a hawk.
Yeah.
This is a dangerous moment for a dog waking up because you're bringing them out of the maintenance of anaesthetic. So it's where the heart and the lungs need to change, and there's lots of physiological changes associated with being woken up. And sometimes that can react badly with the anaesthetic and you can have issues. And hopefully she'll wake up and come back to us very soon.
You gonna wake up?
Come on then. Come on. Go. Nice strong pulse back here, so that's good.
Oh, there she is.
Hey,
I'll have that,
baby.
thank you. Yeah, I can breathe a lot easier now.
Well done, everyone.
Good job.
Good job. Beers are on me tonight at the pub.
I was gonna say, I think I need something more than a tea and a biscuit.
Yeah, totally.
The tense surgery has gone without a hitch, and a relieved Scott wants to share the good news with Bobby and Mary.
How's she doing?
Good is. Here she is.
So here. Oh my goodness. Yeah.
How you doing, Munch?
So how did she make out?
Well, as far as the lump itself, it was exactly as I thought it was. It was the little tip of the iceberg that you could feel, but then underneath there was a mass about 4 or 5 times that size.
Right.
Wow.
I've kept it in case you want to see it.
I do want to see it.
So you can see, so
Mama,
that's,
don't get up. It's okay. It's
so that's just the little tip, okay?
Okay.
That was what you could feel under your finger, and then this is the rest.
Oh my gosh.
Oh my goodness.
It's okay.
Now you need Mama's love, then, huh?
Yeah. Good girl. Very relieved.
For me, the world has come off my shoulders. As soon as I walked down the steps and turned this corner and saw her already awake, it's the best result that anybody could ever have hope for. So I'm sorry. I know I'm a wimp.
You're a good girl.
And you, Scott, you are my hero.
You're welcome, Bobby. You're welcome. My pleasure.
Lucy will need to stay at the practice for further monitoring, and hopefully will be able to go home with Bobby and Mary later this afternoon.
All right, little one. See you soon.
See you soon. Thank you. Okay.
All right.
We'll be right back.
Bye, guys. Hi, Bella. Hi, Suzanne. How are you?
14-year-old Bella has arrived at Scott's practice with her mum, Susanna,
So the new arrivals are here, hey?
and her 2 baby geckos, plus a tortoise named Billy.
The pitter-patter of little feet.
Tiny feet.
Bella and her mum are about to go on holiday, so Bella wants to make sure her pets are in top health because Dad will be left in charge of them at home.
I'm taking the 2 baby crested geckos just to check that they're okay. And then Billy's breathing seems a bit unusual at the moment.
All right, well, Suzanne, do you want to take a seat and I'll take Reptiles and Bella through? Come on in. Bella is a young girl who has a very big interest in animals. She's always wanted to be a vet, and the last time she came in, I was really impressed by her.
I think they're fine, but because we're going away, I just wanted to make sure that everything's okay.
So you're kind of like a lizard grandma now, Bella, aren't you?
Yeah.
Hey?
At the moment, they're quite dull, but sometimes at night they fire up and all their colours become really vibrant.
Wow, look at that. Incredible, isn't he?
So they're called Blondie and Coco, and this one is Blondie.
Okay. Very sweet, isn't he? It's quite funny sometimes, the animals that people bring through as pets in the UK, because of course geckos are native to Australia, so it is quite cute and quite funny to see these animals and nostalgic for me as I think about home. Well, I think they look super healthy. You've done such an amazing job. I can't believe that you've got baby lizards in your house. It just shows you're looking after the parents very well.
Thank you.
If they're healthy enough to have babies, then they're very healthy indeed. Absolutely nothing wrong with them. They're very healthy geckos, and I'm sure they're going to add to that family beautifully. All right, so you said that Billy has got a problem with breathing, is that right? Hello, Chan.
Yeah, it doesn't sound as bad as it did before, but you can just hear it clicking. Every few seconds it's
Right.
a click, which can be a sign of a respiratory infection, so I just wanted to be sure.
Well, he doesn't have a nasal discharge. He's not been snotty at all that you've seen at home, Bella?
No.
Yeah, so his nose is nice and clear. Let's have a little listen, see if you'll let me have a listen. Will you let me have a listen to your chest? Let's have a little listen.
How do you listen to his heart through the front of
Well, to be honest, with difficulty. What we try and do is have a listen underneath his shell, just against his chest. It's really hard to hear through the actual carapace itself, through the shell. I'm just trying to listen to see if there's any heavy breath sounds. I mean, he's not making a huge amount of noise.
Is that a good thing? Or...
It's a very good thing, yeah. If there was lots of sort of maybe like moist sounds or dry rattles, all those sorts of things would suggest that maybe he's got some sort of lung disease or respiratory infection. It's actually quite difficult to listen to a tortoise's chest, but I do manage eventually and everything sounds A-OK.
Do you think he could just be a heavy breather then?
I think there's a distinct possibility he could be a heavy breather. There's nothing to worry about. You're a very healthy boy, aren't you? Yeah. Okay.
Hello.
All right, hello. So a
Thank
lovely
you.
clear bill of health for Bella's reptiles. She's doing a fantastic job of looking after them as always. So I hope you have a great time in Borneo.
Thank you.
Bye, reptiles, and we'll see you very soon.
Okay, thanks very much.
No worries.
Thank you
Look
so
after
much.
yourself, Bella. We'll see you soon.
Bye-bye.
All right, bye. See ya.
So Billy's okay then, you think?
Yeah.
Okay, great.
Right then, little man. Count backwards from 10. Tell me about your weekend.
At his clinic near Marlow, orthopaedic specialist Michael Hamilton is trying to straighten 6-year-old Shih Tzu cross Jake's bowed right leg.
The whole point of today's op is to make sure when Jake tries to walk, his paw lands flat on the floor. Right. Have we got plate benders and pliers? The plan is to actually cut the bones of his forearm and put them into position where his foot is flat on the floor and then stabilise them like that, and hopefully he can then walk.
Assisting Michael are nurses Louise and Kim.
Right. So if my calculations are correct, we're going to make our cut about 25 millimetres above his wrist joint. So we're going to get in there, cut the ulnar. These are really, really complicated procedures because it's not just a simple twist or a simple bend. So we're going to cut the bones. We can plan it for as long as we like and decide where to make the cuts and at what angles and all the rest. But once you've made your cuts, you're then pretty much just got to try and eyeball it in theatre and just get it right. Now what we're going to do is cut the radius. Now the radius is the bone that's causing all the problem. And we actually make the cut parallel with this top part of the bone. Creating, in effect, a ball and socket joint here, and then we can manipulate the bottom half 360 degrees to straighten as best we can. Easier said than done because this is actually quite a small section of bone down here, so yeah, okay. So let's just keep that straight up there. All the time we're checking that his elbow and the paw are moving in the same plane, because when he wakes up, he's going to want to put his elbow like that, and if his paw doesn't go like that, he's not going to be able to walk. I think that looks pretty good. So you can do all the planning in the world, but at the end of the day, really it's kind of, what does it look like on the table? So I think we're good to try and stick a plate on there now.
A metal plate is used to hold the bones in their new realigned position.
We've got 2 screws in the bottom. We've only got 1 screw in the top because this is the last chance we've got to do any like fine adjustments. So we just got to just triple check that we're happy with that. But I think that looks quite good.
A second plate will give added stability.
That'll do, right. On the table, that looks good. So as long as the elbow and the wrist are in alignment, that paw should land flat. So we just need to check it looks good on the x-rays now. We're looking at the pre and post x-rays here. So this x-ray on the left-hand side, we have a straight-on elbow with a sideways paw. That means that between the elbow and the paw, there's a twist, at the very least. And the x-ray on the right-hand side is post-surgery, so we now have a straight elbow and we've got a straight-on paw, so hopefully now he'll be able to walk.
Come on, little man.
Jake will sleep off the anaesthetic before going home with Beth later tomorrow.
Happy. So far, so good. Come on, Jake, let's go. Good boy. Keep going.
A day after surgery, Jake is ready to go home.
Right, Jakey, someone in here to see you. Look, here we go.
Owner Beth has been anxiously waiting to see how the surgery has gone.
Come on in. Come on in.
Jake! Jake!
Come on, Jakey, show your mum what your new leg looks like.
Hello.
Oh, there you go.
Oh,
I'll pop
beautiful.
I'll pop him up for you. There you go.
Hello, darling. Oh, mwah. You're a gorgeous boy. Yes, you look so much better. I'm so pleased to see you. I'm very happy to see Jake walking. Although he looked half drunk, he was walking so much better. And I think he's much happier about it all now. Mike was incredible.
He's a little bit dopey because he's just recently had some more painkillers. But very pleased. The extras look good. Paw looks straight. I mean, he's got a good attitude. He's keen to use that leg, so...
Wow, that is incredible.
You stand him up.
Just looks so different.
Stand him up like that.
Gosh.
That's kind of... Now, it's still got a little bit of a bow that way, which is fine. We've taken about probably 30 degrees off on the front bend, if you like. Probably about 90 degrees off on the twist. But so far, so good. As I say, he's quite dopey still. It's clear to see what Jake means to Beth. I mean, you can just see her face light up as he kind of wandered in with his nice straight leg.
You look so much better.
Yeah. Just makes me feel great. I mean, that's kind of why we do it. So, yeah, really, really happy. Right, so I'm going to hand over to Louise. She can give you a hand out to the car with him. And I'll see you guys in 6 to 8 weeks thereabouts. There you go. There you go, Louise.
Thank you
Thanks,
very
Sam. Right, my
much.
pleasure. You take
Thank
care.
you.
Thanks, Sam.
You ready to go home? Come on in.
In Kew Bridge, Scott is checking up on 17-year-old Lucy, the oldest dog he's ever operated on.
Well, hello, lovely people. How are you? Good to see you.
And her relieved owners, Bobby and Mary.
Good to see you.
Hello, gorgeous girl. How are
she
you?
is.
How are you doing?
She's doing very well.
Yeah.
In the last 10 days, I've been bringing her to the park and for walks, and
She's recovered very quickly.
I think she's doing quite better than what she
think
was
so, too.
before the surgery. She is really back to that loving, happy-go-lucky, I want to run to the park, Dad. Let's go for it. And I think that makes all the difference in the world for me.
And let's hope the third time's a charm this
Definitely.
time. Because the results are back in from the lab and the pathology has come back as a sarcoma. Now, that won't frighten you too much. It's a malignant type of tumour.
Right.
But that's exactly the same result as has been present the last 2 times. And it might return to that area, but she is 17. So if we can buy 1 or 2 or 3 years, then hopefully we're going to give her that comfortable retirement that we all want for her. The whole purpose of this journey with Lucy was to give her good quality of life. It wasn't about buying her more time, it was buying her more quality time. And I really feel by seeing her today, enjoying the company of her loving mum and dad, that's exactly what we've given her.
Happiness is back in to our life, especially Lucy. And tell you the truth, that's the result that we were hoping for. So, yeah, big thank you.
Well, cheers to that and cheers to Lucy.
Well, Lucy will drink to that and so will we. Cheers, guys.
Oh, God, we're keeping you up.
Tired.
Hey? Oh, dear, it's just after midday.
It's time for her afternoon nap.
Good girl.
He's a good boy. Beautiful sunshine today.
5 weeks after his operation, little Jake is enjoying a walk in the park with his owner Beth.
Good boy.
Surgery on his badly deformed right leg means it's now working a lot better, and Jake can lead an active life once again.
It was certainly the last chance for Jake going to Scott, and things are a lot better, and Jake's bouncing around. He obviously wants to play, and he's loving life again.
Well, hello, Beth.
Hello, Scott.
How are you, gorgeous? You're right.
Nice seeing you.
Mwah. Oh, thanks for the cuddle. Hello, little man. Hello, buddy. How are you? Look at you with your 2 legs on the ground. Oh, he looks fantastic. His leg looks far straighter. And how do you feel he's got on since the surgery?
He's walking so much flatter on his paw now, whereas it was really struggling. But he's so much happier. You can see it in his face, he's much happier.
Yeah, you really can. Although he's having a lovely, relaxing time, I'm quite keen to see this bionic leg in motion. Hey, come on. Come on. Let's go. Come on. Yeah, good boy. Well done. Yes, he's a good puppy. Yeah. Come on. Wow, Beth. Little spring lamb we've got.
Not do that before.
It's incredible. Where's the puppy? Jake, come on. Come on. Good boy. Good boy. That is great. Look at that. Jake seems to be very comfortable, and he's really got a spring in his step. It's extraordinary. Good boy. Good boy. Well done.
Never seen him run like that before. It's fabulous. I'm over the moon.
Good boy. Jake, come see me.
And writing to Scott was absolutely the best thing I ever did. And I'm so grateful to him for getting us this far.
That's a good boy.
Thank you, girl.
Rowena is a foster carer from a dog rescue charity.
Hey, Rowena.
Hi there, Scott.
And her latest charge is a young pug cross named Ethel.
How's it going? You all right?
Just a little bit nervous of new people still, but...
Yeah, and very noisy baby.
It's very sad, but this poor little girl has come from a puppy farm, which doesn't surprise me because I can see her abdomen is quite baggy. It's clear that this very young dog has had multiple litters, and it's also very much at the hands of someone who's incredibly unscrupulous. It really is a travesty.
It's really sad to see her in like such a bad condition, obviously, and she was much skinnier and had a lot less hair when she first came in as well. Luckily for Ethel and her sister and a few other dogs, they found their way to All Dogs Matter to find new homes. It was clear that she was in the worst condition with the mange and being so severely underweight. So she came straight into foster care with me.
Ethel really isn't the picture of health. She's very thin, so she's probably had a very poor diet, but also her skin is really bad. And also it's very patchy where the hair has fallen out as a result of a mange mite infection. Well, it looks like you've got the mites under control, which is great. You can see some new hair growth growing back, but that's not her biggest issue, which I can now hear.
Yes, so when you come closer, exactly, that's the first thing you sort of notice about her is that it's like sort of grunty snort. But she really does struggle, and it sounds awful, even though maybe she doesn't show us that, you know, it is maybe difficult for her.
So at rest, she makes this much noise.
Yeah, her body shakes, and she sort of really seems to be struggling to just breathe normally.
Yeah, well, it's one of the occupational hazards of looking like that when you don't have a nose and you don't have much of a nostril either, do you, sweetie? It means that you can't get enough air in.
Can I have a listen to your chest first, Mrs.
Thankfully, her heart sounds nice and clear, doesn't it, sweetie? But that's after I take into account all the huge amount of noise that's coming from up here. It's like she's snoring while she's awake, which is clearly not normal. There is a real rise in the popularity of flat-faced dogs. Therefore, a lot of dog-owning public and people that see them on the street go, oh, it's normal for them to make that much noise, and it really isn't. And certainly in Ethel's case, any point when she's at exercise, she's going to struggle to get the amount of oxygen she needs into her system, and that can mean that it can become life-threatening. So basically what I think we're going to need to do is to give her an anaesthetic back at the practice in Richmond, look down the back of her throat and likely find an elongated soft palate.
So it's almost like a blockage, sort of, so she can't fully breathe in or fully breathe.
And every time she does, it sort of
catches,
flaps away, it catches, it goes into the trachea, the windpipe as well, which is one of the reasons why she's making so much noise, and potentially trim that. And alongside that also, you can see how her nostrils are almost little slits. What we need to do is just open them up, and those two procedures together will hopefully increase the amount of oxygen she takes in with each breath and reduce some of the sort of reverberation that you can hear.
It's a lot easier for her.
And make it much easier for her to breathe. Hey, sweetheart.
Well, we're really so lucky that there is a procedure that can help Ethel, because it will make a huge difference to her life, especially when she goes on to a new home where hopefully, you know, she'll have some dog friends to play with. And if she can, you know, run around and act like, you know, a dog should, then it will make all the difference for her life in the long run.
Not only are you a princess living with Rowena, getting consultations in the park, but now you're going to have a nose job as your first veterinary procedure.
Get your nostrils done, lucky girl.
Yes, but all for a very good cause.
Come on, Kev. What's this? Hey, hello? What's that?
In St Margaret's, one of Scott's feline patients, Kevin, isn't enjoying being housebound.
Hey, buddy. We've been under doctor's orders not to let him outside, and he's not very happy about it at all, bless him. He's absolutely desperate to get back out.
Owner Jonathan has been restricting Kevin's visits outside after the lively Tabby had a mysterious accident 2 weeks ago.
We heard a loud bang outside. He came bursting through the kitchen window, came into the living room, really short of breath, and just was completely unwilling to put any weight on his back legs. So it was a little bit traumatic for him and for me, actually. You want to go outside, mate?
Jonathan took Kevin to see Scott, who prescribed anti-inflammatories and rest.
No, it's tough being indoors, mate. He spends the vast majority of every day looking out the window longingly and meowing. Yeah, I think it's going to be good for both of us when he can finally be let outside again. Come on, mate. Don't run away. Come on, mate. We're going to see Scott. In you go. Come on. Good boy.
Jonathan is worried that Kevin's legs still aren't quite right, so he's taking his little mate back to see Scott for a checkup.
Really hoping that he's actually just going to be fine and there won't be much more to do. But it is a little bit nerve-wracking. I've never had to deal with any sort of serious injury in the past, so it is a little bit nerve-wracking. Come on, mate. Off to see Scott.
Hello, ladies.
Hi.
This is Ethel.
Oh, she's really cute. Wow, she's in pretty terrible condition, isn't she?
Bit of a scabby genetic mess, aren't you, darling?
Back in Richmond, Scott is introducing rescue dog Ethel to nurses Reagan and Sam.
It won't be a surprise to you to know that she's come from the puppy farming trade. She and a few others were rescued.
The 3-year-old pug cross is suffering from severe breathing problems caused by genetic abnormalities.
I can't believe this is still happening, really. And when we know so much about it and people are still putting money into this industry, it's just crazy.
So I'll leave you guys to get you ready for surgery. I'll go get changed, all right?
Cool.
See you in a sec. Ethel, as a case, just really upsets me. Why was she ever bred in the first place? Because the condition that she's suffering with is genetically inherited. She's suffering, so why would you spread that suffering to other puppies? Let's give her the anaesthetic and start having a look down the back of her throat. Because Ethel is a pug-type breed, a brachycephalic or flat-faced dog, she doesn't have much of a nose, and so a lot of the structures that are present at the back of the nose in a longer faced dog are shunted into the back of the throat. And what you can clearly see now that Ethel's on the table is that her soft palate is sort of flapping in the breeze like a curtain in an open window and going right down and into the larynx. That means that every breath she takes, she will sort of swallow that part of her soft palate, and that leads to that incredible noise. So as soon as we tube her, you'll find this noise will go away. And there, the sound of silence. Okay, good girl. So let's get her next door and get started. The procedure I'm about to perform on Ethel is basically the shortening of the soft palate, but also performing a Allarplasty, which is basically widening of the nostrils. So what I need is for you to hold the soft palate out the way. So I'm going to place 2 stay sutures in. You hold these 2 sutures and then you can lean on me for support and I'll then trim the soft palate accordingly.
Cool.
Get you to on either side.
Yep.
Like that, that's it. So there's the soft palate, that's the bit that's going down our little girl's throat, and that's the bit that I need to trim. If you give that quite a bit of tension, you have to put your elbows on my shoulders, it's absolutely fine.
Okay.
There we go. Oof. A bit of disgusting smelling smoke, and that's a very chunky piece of soft palate. What you can see is by removing that flap, you've now got an open airway, because you can see that that is basically like trimming the curtain, so the curtain's not going down the window anymore. The window is nice and open. You're getting lovely airflow. So I'm just going to oversew that. If you just release now, and we'll have a little look.
Wow, that really is such a difference.
Yeah, actually you can see a larynx.
Yeah.
Good, okay, so that's part 1. So now we're going to do something called an Allarplasty, which is changing the shape of the nostrils. In this case, I'm doing that in order to increase the nostril size and therefore get more airflow going into her nostrils, more oxygen, therefore she should be able to breathe quieter and exercise better. See how much that's opened up? Here we go. There is Ethel's new nose.
Ethel's new nose.
And not a bad looking one at that.
It's a lot bigger, isn't it?
Yeah. All right. Let's wake this girl up. Oh, good girl. Good girl. Hello, baby. Hello. Guinness Book of Records for that tongue. Look at that. You can lick your own forehead. Like that's incredible. But listen to you. Can't
hear anything.
Exactly, that's my point. Yeah.
What's incredible about this particular procedure is that literally straight after the surgery, you will see, or rather hear, a massive difference. And this dog should hopefully breathe a lot quieter and a lot easier.
Have a little nap, start organising that spa treatment, yeah? Lovely bath for you, I think. Yes, before you head off. Good girl.
Hey, buddy. Off to see Scott.
In St Margaret's, Jonathan and his little mate, 11-month-old Kevin, are arriving to see Scott.
Morning, Jonathan.
Hey, guys. How are you?
Yeah, good. Hello, Kev.
Oh, isn't he cute?
He's a legend, isn't he? So his knee's still causing him some concern?
A little bit. I mean, the limp's gone, but he's a little bit laboured on the back leg, so it'd be interesting to see what you think today, to be honest.
Come on then, let's go.
Cool. I am very worried. Yeah, he doesn't look too great on his back legs. His movement's not the same as it was before, so I'm a little bit nervous as to what Scott might find.
So you say laboured?
Yeah, it just doesn't look the same as what it was prior to the injury. I don't know, I can't quite put my finger on it, but it just doesn't look quite right.
Okay, well, I suppose he's a very young boy, so he should be very fluid in his movements. It should be
Yeah.
effortless for him to jump and run.
It seems like more of a waddle on the back legs.
Right. Previously, when I examined Kevin, it was clear that he'd injured his left leg and his kneecap was popping out very, very easily. You could barely have to touch it for it to pop out. The kneecap normally sits in a groove, and in some cases it's a little bit shallow and it pops out whenever the knee is bent. Good boy. So let me just have a little feel. Oh, yeah, wow. Yeah. Just feel this side as well. Oh, gosh. Ooh, okay. The last time the left leg was popping out.
Right.
And it's still doing the same thing, but the right leg is now doing the same.
Right.
So literally, I'm feeling his knees, goes pop, pop. It just keeps doing that. It's just without even touching them. And then when he straightens his leg, it flicks back.
I see him stretching a lot, actually.
He's stretching a lot?
Stretching them a lot, yeah. He keeps them out back. And
there you go. See, he's learned how to pop them in himself.
Right, okay.
Which is so clever, isn't it?
Yeah.
Cats, eh? Amazing.
Yeah.
Dislocating patella is a congenital condition, which was most likely aggravated when Kevin had his mysterious fall.
Very uncommon in cats. It's more common in dogs that have really bowed legs.
Right.
And the longer that his knees pop out like that, the more rubbing on the cartilage, which is the protective surface of the joints, the more likely he'll then develop arthritis later in life because the cartilage is worn away.
Yeah, okay.
And we don't want that.
No, of course not, yeah.
So we kind of have to act now. It's unfortunate, but I think he's young, he's strong, he's healthy. So I think it's just let's get it done and move forward.
Agreed.
Yeah. It might sound crazy to perform surgery on both knees. Essentially, it's making a relatively active cat disabled for a little while, but it is all in his best interest because it does mean that he'll only have to go through one recovery period. And really, it is just a case of taking one step backwards before moving forwards. Hey, mate.
All right, mate.
What do you think about that? He's like, that sounds awful.
I wouldn't be too excited, personally. I'm pretty nervous, but he's in good hands with Scott, so I'm sure he'll be okay.
Trying to say goodbye to Daddy?
Bye,
Big
mate.
cuddle. Hey.
Oh, be good. Love ya.
Boy.
Find it! Come on! Flora, come on!
In Isleworth, local vicar Ali is braving the cold to exercise her beloved Border Terrier, Flora.
Good girl!
Flora's about to have her 4th birthday, and we've had her since she was 9 weeks old.
Good girl! Leave it! Leave good girl!
She makes us laugh the whole time, and we say, you can't possibly be miserable with Flora around because she just makes us smile and makes us laugh. I don't know, Flora, what are we going to do with you?
But while Flora's an angel around the house, she turns into a little devil whenever she encounters other dogs outside.
She'll take on anything if she's scared of it.
Ali says Flora's once friendly personality changed 2 years ago when her and her husband made the move from Cambridge to Isleworth.
When we moved here, Flora started barking at the windows. And then gradually, when I took her outside, that sort of reaction started to transfer itself onto just about any dog she saw.
Good girl. You don't need to be frightened because there are no other dogs here, sweetie.
Flora's antisocial behaviour is taking its toll on friendly, outgoing Allie.
Something that Flora should be able to enjoy, like going for a walk, is so stressful for both of us. And the number of times that I've come back from a walk almost in tears because she has reacted so badly.
Allie now realises she needs professional help for her little dog and has asked Scott to make a home visit.
I'm hoping that Scott might come for a walk with us and see her react, and that he then may be able to give me some strategies for actually helping her to become more comfortable with other dogs. And I just want Flora to be able to go for a walk without being so overwhelmed by fear of other dogs all the time.
Where's it gone?
Mate, not only have you got to go through 2 knee surgeries, he's got to wear a bright pink bandage.
At the St Margaret's practice, 11-month-old Kevin is being prepped for major surgery on both his back knees.
So we can just give him his anaesthetic now. You ready?
Nurse Nathan will be assisting Scott with the surgery on the young cat.
Good boy.
With this surgery, it's a complicated one, it's a painful one, and it has a long recovery period. And without the surgery, eventually his knees will seize up, he'll be in too much pain, then he'll start getting osteoarthritis, and he'll basically be an old man in a young cat's body.
Nurses Reagan and Alicia are also assisting.
How undignified.
Okay, good job. Right, let's have a little look. So you can just see, so there's his kneecap there. And so you can just see that? It's pretty gross, isn't it?
Yeah, I don't like that. That's horrible.
And this one's actually worse. So you can just see it's out and then pop.
Yeah.
Now that Kevin's under anaesthetic, you can really see the severity of the dislocation of his patella, his kneecap. You just know that this cat is in pain every single step he takes.
And then it goes all the way up before it goes clunk.
It's funny because it's a condition you normally see in smaller dogs, isn't it, rather than cats?
Absolutely. Small, bow-legged dogs.
So does he show the classic signs of skipping, or...?
He doesn't. Instead, it's more like a cowboy trying to run in those boots.
Looks more like you dancing.
Yeah, you don't look like me dancing, mate. That is not a good look. You saw me at the Christmas party.
I did, yeah.
Yeah, okay. All right, then. Let's get on with the surgery then, shall we?
Today I'm going to be performing a trochleoplasty on Kevin, and that just means the remodelling of the groove that the knee sits in, basically deepening it, and so the knee will stay where it's supposed to and not dislocate.
It is quite a complicated surgery, but a rewarding one when you get it right. I'm just taking a section of the important articular cartilage away. I'm going to put that to one side, kind of deepen the groove further, and then I'm going to put it back. This surgery does require a lot of concentration, and you are using quite large, scary, sharp kit. So you do need to make sure that you have your wits about you and you keep working at it until you get the perfect result. So now I've just replaced the wedge back into the groove, and I've got a couple of millimeters of ridge on either side now. So what that's going to do is almost bumper the patella into that groove and keep it there.
Scott is now doing the same procedure on Kevin's other knee.
So there's the trochlear groove. Okay, you can actually see at the top there, it's quite flat indeed.
Now I've got the second stifle joint, the knee, open. I can see that it's equally shallow as the first, so it's very clear that this surgery was required on both legs. And I think Kevin, in 6 weeks' time, will be happy that I've done it all on one day.
It's okay, it's okay, I know.
Kevin will recover overnight at the practice and will hopefully be ready to go home tomorrow.
All right. Oh, I know. Oh, it's tough, isn't it? Okay, buddy. Sleep it off. All right? Good boy. Good boy.
Hi, Ali.
Scott. Lovely to see you.
And you. I'm looking forward to meet Flora.
Yes, and Flora's looking forward to meeting you, so come on in.
Thank you very much.
In Isleworth, Scott is answering Vicar Ali's SOS about her antisocial dog, Flora.
Positively vicious, isn't she? Hello.
Flora.
Hello, baby. How are you?
While Scott's getting a warm welcome, Flora has been demonstrating a dramatic change of personality around other dogs.
So far, so good. You seem perfectly well balanced and perfectly calm, but I hear that all is not well when she ventures out of the rectory. Is that right?
No, that's right. So when we go outside, she will turn into a lunging, growling, snarling heap.
Ooh. You can hardly imagine it, looking at her now.
It's quite scary.
And when did all that start?
Basically, we lived in a small village of 3,000 people. She was fine with all of the other dogs in the village, apart from one, which was a Rottweiler who didn't like puppies. And each time we met this Rottweiler in the village, she dived for my legs.
Right. Wow, how frightening for you and for her.
It was very frightening, yeah. Not long after we moved here, she started reacting to other dogs because there is a Rottweiler that lives just down the street, a few doors down. Gorgeous, beautiful, gentle dog.
As generally they are.
Yes, but she's Flora's archenemy. And Flora
Have you got a nemesis, have you?
She does have a nemesis, and she goes absolutely berserk when this nemesis goes past.
But interesting already that you say that in her history she had a Rottweiler that she didn't like.
Yes.
That we have an anxious dog and we have an anxious mum.
Yeah.
And that is not a great combination.
No.
Because if she starts feeling nervous about something, you feel the same way. I think it's not healthy for either of you.
No, and I'm aware of that. So it would be great if we could get her to the point where actually she's happy and I'm happy.
Yeah, let's get to work. But first, I need to see you at your worst.
So, Scott, what I've been doing so far is when we go out, I have a yellow lead for her, which says, I need space.
Right.
And
subtle. As is.
I wear a yellow vest, which says, my dog needs space.
From my online research, I discovered yellow vests that we can both wear.
It was a last resort because I didn't really know how else to communicate to other people, to ask them to keep their dogs away. And some people have been really, really unhelpful.
Yeah, it's tough, isn't it?
Yeah, it's a problem.
But does that lead to Flora having absolutely no social interaction whatsoever?
Yes.
Which isn't healthy either.
No.
Now that I've met and understood what Flora's problems have been in the past and what kind of dog she is inside the house, I do need to unleash the beast. I do need to allow her to go outside to meet other dogs and observe the behaviour. So, Ali, how do you feel whenever you leave the house?
Often, Scott, I feel quite nervous when I'm opening the door because I never know what dog might be going past.
And it doesn't take long before Flora shows her true colours.
Come on, this way. Good girl.
In Isleworth, Scott is witnessing the dramatic personality change in Flora when she encounters other dogs during her daily walks with Anna Alley. Flora becomes particularly agitated whenever she sees big, gentle Rottweiler Grace, who lives just down the road.
You can see that Flora's hackles are raising. She starts to gnash her teeth. She's pulling on the lead. And Ali looks quite stressed and quite nervous as well. So you can really see that this situation is escalating and it is becoming a really aggressive and angry affair. Dear. So that was quite a violent reaction, wasn't it?
It certainly was, yes.
And is that normal?
Yes, that's pretty much.
So that's your everyday walk in the park life, is that?
Yep.
Wow.
Yep.
Okay. We've got quite a bit to work on, Mrs. That is incredibly antisocial. It is such a massive shock to see Flora, a very affable, friendly girl, just turn into this aggressive beast. I mean, she's gnashing her teeth like she wants to rip this Rottweiler to shreds. It's just such a shame that she can't control her emotions and fear is leading to aggression. And it's just unpleasant. It's unpleasant for her and unpleasant for Ali.
lot to take in today. So what we need to do is to work on her anxiety. So I'm going to ask you to come into the practice and we're going to look at a few different things that we can use to try and reduce her anxiety from a medical and behavioural standpoint.
Yep.
First things first, we're going to ditch this because that makes me stressed just looking at it. I don't think it is going to help you or her. I think it's going to make other people more anxious.
Yes.
I need to get you to enjoy this dog again. I need you to drop your shoulders and relax and smile a bit more.
Okay.
And tell yourself it's an enjoyable activity to walk your dog. And I think all you think about is, oh my goodness, what she's going to do today. Who is she going to lunge for today?
Yeah.
I need to go, this is going to be great. It's going to be really positive and happy. Be relaxed, be calm, and transfer that positive energy through the lead.
Through the lead to her. Scott's been really encouraging today. He's given me real hope that actually we can get to the place where Flora and I can enjoy our walks and they can be happy experiences for both of us.
It's a plan.
Yep.
All we can do is onward and upward.
Thank you very much. Thank you.
Hey, good girl.
How are you feeling today, Ethel? You doing well?
In Richmond, rescue pug cross Ethel is recovering well from her throat and nose surgery to correct her noisy breathing.
Come on then, let's get you bathed. There's a good girl. Hey? Here you go. Here you go. Give it in.
Oh, you are here. I couldn't hear you.
Nurse Jess and practice manager Maz are now going to give the little rescue dog some much-needed TLC.
Is that nice? Is it? Oh, thanks.
Ethel's responding really well to all the affection and attention. I think she's really coming round to us all and getting used to a better life compared to what she came from.
You better get used to these, because once you get out and about in the park, bet you're one who's gonna run in the mud. Aren't you? You're gonna find the muddiest puddle. We thought it'd be really nice to give her a little treat, a little bath, smell a bit nicer, make her fresh and beautiful, all ready for her new forever home that she's getting to go to. There we go. Oh, that's all right, see?
It's nice, see?
Upstairs, Ethel's foster carer Rowena has arrived to collect her.
Yeah, I'm so excited to get her home. Not only for us, we get to see how she is and, play at home and see how she's doing, but I'm very excited to meet her new potential home and hopefully they'll be taking her soon.
Hello, here she is.
Hello, little one. She's like, who are you? I can barely recognise you with your new face. Oh, no. Hello.
So she's done so well since the surgery. Not only has it made a massive difference, as you can hear, to her breathing, and that she's not making hardly any noise now, which is wonderful, but also transformation in her personality. Like, she's really come out of a shell,
really,
just
that's amazing
being with
to
us for
hear.
such a short period of time, and you're really getting a bit waggier and a bit happier and certainly breathing better. So
That's so good
emotional
to
and
hear.
physical results. So yeah.
Well done, Ethel, and well done, all of you.
I really feel today is the start of a new chapter for Ethel. She's had a terrible start in life. It's literally had her puppyhood robbed from her. She hasn't had access to the great outdoors. She hasn't had medical treatment. She hasn't had love. And now we've been able to treat all of those particular issues and work on her shyness and her emotional side. And hopefully now she'll be a happy, healthy, well-adjusted dog that can go off and enjoy life.
I couldn't do anything about the tongue, however, because she has a massive tongue and a tiny mouth, so she'll always have her little tongue tip, won't you, sweetie? But hopefully now everything is as good as it can be for her to find a new home.
It's amazing. That's so exciting. I'm sure she's very excited too. Probably don't realise it now.
All right.
You're not going to want to leave.
Bye, Ethel. See you later, Rowena.
Thank you
Take
so
care.
much.
Bye.
Thank you. Bye-bye.
Bye, girls.
At the St Margaret's practice, Jonathan is returning to collect his little mate Kevin a day after his double knee operation.
Look forward to seeing Daddy. Yeah, big one.
Massively excited to see him. It's only been a night, but it's felt like forever, yeah.
Hey, how's it going?
Good, thank you.
Who's
How
that?
is he?
Yeah, good. Is that your daddy? Wow. Yeah. He's done so well.
Look at you.
Shall we show Daddy your crazy legs?
Please.
Shall we? Hey. So he's got two leg dressing. He's not that impressed by.
I'm sure he's not. Mate.
So.
Oh, you poor thing.
So he's got 2 leopard skin bandages on, as you can see, but that's just supporting the knees whilst they're trying to heal.
Okay.
And also because I have a sense with him that he'll just want to get up and go straight away.
He will, yeah.
And we need to kind of keep him a bit calmer and a bit quieter. And the best way to do that is by having dressings which are a little bit cumbersome, which have a benefit to his knees, but also will just kind of keep him that little bit quieter.
Sure, okay.
Hey, mate.
Kevin will need to be housebound for 6 weeks and will also have physiotherapy to help his legs heal.
He's a trooper, yeah, he's quite resilient. It's clear that he's quite resilient, so yeah, I'm sure he'll have no problems in recovering.
Such a good little patient. Yes, you are. It just goes to the resilience of cats. He's just like, well, you know, where's my dad?
Yeah,
you know,
get me home.
Get me home. Give me some more love. And this is a tip for the future of getting him in a box.
Sure.
Always put a cat in backwards.
Okay.
All right. And then you're about to make it happen. Good boy. That's it.
There he is.
Scott will check on Kevin's progress in 6 weeks.
He's been prescribed a lot of fuss, a lot of rough scratching, so that's exactly what we'll be getting over the next few weeks.
All right, then. See you
Thanks,
later.
Scott. Much appreciated.
No worries.
Thank
All right,
you.
we'll see you very shortly. We'll see how he's getting on. Hey, mate, we'll get those off very soon, I promise. All right, take care, John.
Thank you. Cheers.
See ya. Bye.
Come on then, Flora, we're going to go see Scott. This way. Good girl, Flora.
Morning, Ali.
In Isleworth, Ali and her nervous border terrier Flora have arrived at the practice to check in with Scott.
Is she being a good girl?
She's being a good girl, at home.
Yes.
Not quite so good outside.
The last time I saw Ali and Flora's behaviour, well, it really was quite upsetting and it really was taking a toll on poor Ali. So I've asked them both to come into the practice. We're going to try and work through a few strategies to try and see if we can get them on the right track. What I wanted to do is to go through a few things that would just help to try and just calm her down because we know she's quite an anxious dog. So one thing is some medication. Now, it's not like an antidepressant, which we can use in dogs. This one just helps us sort of have a nice and calm and relaxed so that in this period where we are trying to retrain her, recondition her to actually enjoy the company of other dogs, just takes the edge off a little bit. All right?
That sounds really good.
So that's first things first. And the second one is basically like a plug-in that you would use to have a lovely smell in your house. But you won't be able to smell this, but Flora can. And this will sort of pervade into your house. And so Flora, whenever she's home, will feel really relaxed, really calm, very zen. And hopefully, again, that will just reduce any stress levels that she's feeling.
But the main reason Scott has invited Ali and Flora to the practice is for another strategy he's keen to try.
But first things first, it's all about socialising, okay? So today I've got a little visitor.
Oh, okay.
Yes. So I'm going to be introducing her to our boy Branston, who's a really calm, relaxed dog. And hopefully, if all goes well, take them on a walk together. And on one side, you're going to be in the corner, happy, smiley, excited mum with lots of treats ready to go, getting her attention, and we're just going to see what happens.
Okay.
Let's go for it.
I'm slightly nervous because I don't really know how Flora might react, and I'm really aware that this is somebody else's dog, and I don't want Flora to react badly.
Flora, what have I got? What's this?
Lots of positivity, Ali, lots of happiness.
Yes, what have I got? What have I got here?
Branston, Branston,
girl,
sit,
Flora.
sit. Good boy.
Look, I've got treats for you. Good girl.
If you just move a little bit closer to us.
Good girl. Good girl.
We're going to try and do something that I know that you haven't done since you've been in Isleworth, which is to have two dogs off lead together.
Off
You ready?
lead.
Don't look so frightened. Nice and calm. Good girl, Flora. Good girl. So you let Flora off the lead. That's it. Branston, come.
Such a good girl.
Oh, good girl.
Good girl,
Oh,
Flora.
wow. It's so exciting. Hello,
Good girl,
everyone.
Flora.
Yeah.
By using the treats with Flora and making her sit and keeping her focused on me, Scott was able to bring Branston in, and Flora completely ignored both of them.
So when's the last time you saw her this close to a dog off lead?
A long time,
Yeah.
8 months.
Wow.
And that ended up in a fight.
Good girl. Oh, she's a good, brave girl. Yes, she is. Well done. It's because she gets fearful. But if we can see off the fear with positivity and food, then we can make things so much better. And this is good. Just to have them in the same room, off the lead, is a massive step forward.
Yes.
So now I think what we'll do is we'll go and enjoy the snowy weather of Isleworth together, shall we?
Let's have a go, yeah. Let's
have our first his and hers dog walk.
Excellent, we'll do that, yes.
Come on then, do you want to go for a walk? For Ali, up till now, it's been all about isolation and stepping away from the situation. There we go, good dogs, well done. But me, I'm a positive person, I'm a social person, and that's exactly what I want for Ali and Flora. So hopefully that little bit of positivity sprinkled over the situation will make a big difference.
That's a good girl.
Good dog, Branston. But she likes food, and that's very helpful.
Yes, she does like food.
Yeah.
That's a good girl.
I know we're sort of bribing our way into this situation, but actually for you to be able to walk this close to another dog is a first for a while, isn't it?
It certainly is. We haven't done this for a long time.
I wouldn't exactly say that Flora is loving Branston's company, but she's tolerating it, and that is a massive step forward for this upset little dog.
Oh, Flora, you're such a clever girl, aren't you?
Good girl, Flora. Well done.
Flora.
Good girl.
Well
So you can walk near a dog. Hey? So with a lot of positive reinforcement and some calming medication, I am really hopeful that things in a few weeks' time should be really improved. Well done, that's excellent.
That's such a good girl,
Really good.
Flora.
At Scott's Richmond practice, vet nurse Reagan is bringing in one of her own pets for a checkup.
Hello.
Hiya.
All right.
Good, how are you?
Good. What have you got in the pillowcase?
And receptionist Kirsty is intrigued.
So this is my corn snake.
Okay.
His name is Allard. I got him a few months ago and I just brought him in to see Nathan and
that's a good idea.
see what he says and show him off to everyone.
Oh, he's really cute. Can I maybe hold him?
Of course you can.
Is that right?
Put him around your neck.
Oh, lovely.
Allard is a corn snake. They're quite a common breed of snake to have as a pet. They're very placid.
It's actually quite warm, so I thought it'd be really cold.
My first pet was a leopard gecko when I was 6. So I've always had a thing about reptiles. I think they're fascinating.
Ooh.
There we go.
Well, that was different anyway.
I'm bringing him in to see Nathan, who does know quite a lot about reptiles and snakes. Right, let's go give Nathan a surprise. Just because I'm slightly concerned that he hasn't eaten in a few weeks, and I just want to make sure that there's nothing wrong with him.
Oh, hiya.
Hey.
Okay. Wasn't expecting that. Something with a pause, but...
Yeah, no, not today. No legs today. Yeah, this is my snake, Allard.
What have you brought Allard in today for?
Well, he hasn't eaten in about 3 weeks. He's very lively in his tank, which I haven't seen him be before. So he's constantly out. He's never under his log. He's always out and about. And I was sort of just wondering if that means something or if he's ill or I don't know, just a bit worried about
Just a little bit concerned.
Yeah.
Yeah. We're used to animals such as cats and dogs, and when they stop eating, we do worry. But reptiles are very different. Sometimes it can be the heat inside the vivarium. It's not quite hot enough, or it could be that the humidity is wrong. But sometimes it could be as simple as I need to find a friend. Given the time of year it is, I just want to check whether he is just a little bit randy. So this time of year, when it's warmer, it sets off a trigger, which is mating season. And this is what I think Allard's up to. Now, I know we've called him a him.
Yeah.
Have you had this checked out?
No, I haven't. I don't know if the previous owners have.
To confirm whether Allard's lack of appetite is related to an overactive male sex drive, Nathan needs to check that he definitely is a boy.
So the way we sex snakes is to put a probe up there.
Okay.
So what I'll do is I'd ask you to hold Allard for a minute.
Mm-hmm.
Unfortunately, I didn't bring my probes with me. So I'm going to use something gentle, but also something that will do the job as well. So I need to go underneath this scale here. The further it goes up the tail means it's a boy. If it doesn't go up quite so far, this is a girl.
So what's the verdict?
It's a boy.
Okay. Good, I'm really glad.
Given the season and now obviously his sex, I think at the moment he is just concentrating on finding a mate.
So yeah, he's just a bit lonely, looking for a girlfriend, which It's quite relieving for me to know that there's nothing too serious going on with him.
What I would say is it might take a few months for Allard to calm down.
Okay.
Weigh him, make sure that he's not losing any weight.
Okay.
But I'm not too concerned at the moment.
It's great to have someone like Nathan in the practice that is so knowledgeable on reptiles, so I can just kind of ask him whenever I need to if I've got any problems, and he's always got the answers. Well, thanks, Nathan.
That's okay.
He wants a girlfriend.
He wants a girlfriend.
Sorry, Allard. We can't sign you up to Tinder just yet.
It's 6 weeks since young cat Kevin had surgery on both hind knees, and Scott has arrived to check on his progress.
Hey, Jonathan, how are you?
How are you?
Yeah,
Nice to see
good.
you.
Really looking forward to seeing Kevin.
Come on in.
Thanks very much. Cheers. Here's the boy. Hello, Kev. How are you, mate? And Jonathan, very impressed. You've been very good.
Following
Keeping
doctor's
him in his
orders.
crate. Following doctor's orders. Good to see. Hello, champ. And you're raring to go, aren't you?
Yeah.
Good boy. Hello, mate. Wow. Oh, lovely big stretch. Yes. Hey. I mean, he still looks bizarre.
Yeah. Yeah.
But walking really nicely, isn't he? Yeah. I mean, how do you feel he's been getting on?
It feels like nothing ever happened to him, to be honest. To look at him now, it doesn't look like there's any sort of adverse effects of it at all.
Let's have a little look at you. Can I have a little look? Good boy. Good boy. Let's have a feel. Okay, so that knee is sitting exactly where it's supposed to. What I can pick up now is that just basically the kneecaps are staying in the groove. Before, they were just popping in and out with the bands, and every time you bent his knee, it would pop out and then it would go back in when it was straight. But now they seem to be sitting in nicely, much more stability and hopefully much more comfort as a result. So
good.
I think what's shown today is that actually Kevin's done incredibly well. He's responded beautifully to the surgery. The knees feel great, but right now, I'm just glad to see that these two are still happy and comfortable and still great mates. Yes, he's obviously frustrated. He's normally the man about town, and at the moment he's a cat in a cage.
Yeah, best thing for him though, right?
Absolutely. But just to see him walking so comfortably and just getting around the flat again, and hopefully going to mean that his future's bright and he'll be marauding the roads around here for some time in the future.
Good.
Scott is also checking up on antisocial dog Flora, who belongs to the local vicar.
Well, hello there, Ali. How are you?
Hi, Scott. I'm fine.
Great to see you. You look very relaxed.
Thank you.
Even better, how relaxed and calm are you? With dogs just there. Look. What a leap you've made since I last saw you.
Yeah, she is working hard and I'm working hard too. And I think maybe one big difference is that I'm making much more of a conscious effort to be more relaxed when I'm out with her.
And it shows. I'd say that she's staring lovingly at Big Al, but she's staring lovingly at the pocket of your friend with the treats in it.
Who's sitting? Al sit?
I think that's probably the case, yes.
Yeah. But hey, we'll take it, because
We will.
eventually just being around other dogs and being calm will pay off. It might be that she goes, you know what, Big Al and treats in equal measure I quite like.
Yeah, indeed.
Look forward to that day.
Yeah, it's very impressive. So here's your treat. Now, you're going to let me give Big Al a treat. Good
Oh,
boy,
wow.
Big Al.
Very good sharing,
girl,
Flora. What a transformation, hey?
Indeed, yes, it is.
Actually enjoying the reason why you got a dog in the first place.
Yes.
Is to be social and to be outdoors.
Yes, indeed.
Now that I've seen Flora in action and she's doing so well, as is the very calm and assured Ali, I think the ultimate test is exposing her to the lovely Grace. See what happens.
Grace is a local Rottweiler, and Flora has always reacted violently to the big, gentle dog.
Don't expect her and Grace to be best pals. I just want you to be able to walk down your street with Grace in the other direction and her not kicking off. That's
Okay.
all I want.
Great.
Let's give it a go.
Let's give it a go. I feel a little bit nervous and anxious, but I'm happy to give it a go. Come on then.
Good girl.
Come on
That's
then.
it.
Good
So when we
girl.
see Grace, we can
Come
just
on
get her
then.
attention. Good girl, Flora. I know. And then sit. Good girl. She's not perfect, but you know what? This is just a few weeks.
Yeah.
A massive seismic shift from
It
what
is,
it was
definitely.
before. Because what Flora did then was she clocked Grace. She went, oh, there's Grace. Let's go and tell her off. And then immediately goes, I'd rather have treats.
than be a bit aggro.
Yeah.
And that's such a win.
Good.
Such a win. So well done.
Well, thank you.
Amazing.
That's brilliant.
Oh, it's been a pleasure. I'm so proud of Ali and Flora. This duo were quite fearful and antisocial in a lot of ways, and now they're joyful, they're outdoors again and just enjoying the company of each other and of other dogs. And I just think it's been an incredible journey and a great result. Well, after that, I think we need to celebrate. So let's go for another leisurely walk to the pub.
That sounds like a good idea.
Come on.
Come on, sweetie.
Good girl. Well done. Hey, Charlotte.
Hi.
Okay. Is this the new recruit?
It is. Oh my God.
In Richmond, Scott's day is beginning with one of the youngest and tiniest patients he's ever seen, an 8-day-old Chihuahua puppy.
Puppy.
Brought in by a very worried owner, Charlotte.
He was born with a cleft lip and cleft palate.
Oh my God.
Let's just have a look and see. Oh, wow, okay.
The deformed palate means every day of the little Chihuahua's life has been a struggle.
Oh, sweetheart, you're already looking hungry. Look, you're trying to eat your hot water bottle.
Because he can't latch on to either his mum or a bottle, and he isn't putting on weight.
At birth, the vet stitched up all the roof of his mouth and stitched up the hair lip, and the hair lip's just not holding. He's had to be restitched 3 times already. Something more permanent has to be done.
With the temporary suture out, is he able to suckle at all?
No, he can't. He hasn't got the vacuum that's needed to get the milk out.
Yeah, I mean, look, he's already hungry, you can see. Aren't you, mate?
There's now only one option left, more surgery, but this time under anaesthetic, a risky thing for such a young dog.
Let's go into the consult room and we'll chat about this very fraught surgery we're going to have to do on you, little man. Come on, then.
I have absolutely no choice. I need to perform surgery today. Yes, he's 8 days old. Yes, he's a high-risk anaesthetic, but I have no choice because without performing this procedure, he can't latch onto mum, he can't suckle milk, and unfortunately, he will end up starving. Well, this type of patient and also this type of surgery is incredibly fraught and not something that we want to do. But in his case, if he doesn't have the surgery, he will basically fade away and starve to death. Yeah, the other possibility is that he can also aspirate the milk, breathe it in and die suddenly. And you've only had him for 8 days, but I can tell you're quite smitten, aren't you?
Yeah, he's stolen my heart. Absolutely in love with him. He's like a member of the family already. And I've been hand-rearing him for the last 8 days. I'm so in love with him already.
Well, I'm gonna take him downstairs and see the team. Say goodbye to your little man.
Good boy. General anaesthetic for an 8-day-old puppy is never good. It's never something you want to do, but it really is his last hope. I'm just scared that he's not going to make it.
Hi, guys.
Hiya.
Right, so we've got a difficult job in our hands today, guys. So we're really going to have to keep our wits about us because you can just see the size of that hair lip.
Oh my God.
Yeah.
It's really sad.
But now, unfortunately, the temporary sutures that were put in at birth, you can see, have just blown. And now he just can't clamp down. He can't just get the suction that he needs to suckle properly because you can see there's actually a little tiny, tiny, tiny little hole just there, like a pinhead. But still, it'll be too big and he won't make it. So we do need to perform an anaesthetic and surgery on this guy.
Nurses Nathan and Reagan will assist with the challenging task of anaesthetising such a tiny patient.
It's a anaesthetist's nightmare, that is.
Yeah, well, I think it's anyone's nightmare.
Yeah, you know, a young animal, old animal, we all know that they are the riskiest.
And he won't make it if we don't do this. All right, let's start the process. Just a little bit of anaesthetic. Everyone cross your fingers and toes and paws. Because we have to do surgery on his head, we can't have his head in a mask.
No.
So when we get down to a point where we think that he's deep enough, we're going to quickly flip him around, okay? And then Reagan, if you can extend his head, and then I'm going to hold down his tongue and try and get the tube in, all right? First task to be tackled is to try and navigate the anaesthetic. Can we place a tube down his throat? Can we place a tube in his nostril? Let's give it a go. So you're going to pull the mask off and you're going to spin him around to me, okay?
Ready?
3, 2, 1, go.
Scott is hoping a narrow tube down the throat will be the most effective way to administer anaesthetic to his tiny patient.
Puppy.
But it's proving more difficult than he thought.
It's a tiny little head, he has a really big tongue and gets in the way of our ability to look and see the larynx and pass that tube through.
Yeah, just going to gas him down a bit more, it's too light. What is he on now? Is he on 5?
4, he's on 4.
So put him up to 5. I think what we'll do this time around is we'll just try straight onto this. So we'll go into his nose, try this.
Because he's so small, he's got such a fast metabolism, so he's quickly removing the anaesthetic from his system. So he's giving us such a tiny little window to perform this microsurgery. It is really proving tough.
Okay, let's try again. Attempt number 52. Not sure, but maybe. I know it's so difficult to tell, but can you see the bag moving, Reagan?
No. Oh, wait, actually. It's like it's sort of working, but not completely.
Yeah, so I'm going to take that out and we're just going to try the mask. All right, sweetie. Okay. Okay, so the new plan is basically can't get the tube down and he doesn't seem to be tolerating the nasal tube either, so we're going to keep him nice and deep. You're going to just put it over his nostril. I'm going to scrape. We're going to put it back on. Okay. All right.
The pressure really is on Nathan and Reagan. They're the ones that are responsible for the anaesthetic, maintaining that and ensuring that he recovers from it. So it is quite a high pressure procedure. He's a tiny puppy.
So I'm just going to scrape the edges, okay? And then we'll put him back in the mask. When we're all happy again, and Nathan, you think is deep enough, then I'll be putting the sutures in. Okay. All right? All right, let's go for it, everyone. Ready? 3, 2, 1, go.
With the anaesthetic now finally working, Scott can clean up the pup's lip and at the base of his nose. He can then place sutures to permanently hold the edges together.
Okay. Ready? Yep. So just take our time, control our nerves, and we'll go back in. His heart's beating nice and strongly throughout, so and as much as it's not very nice to hear him cry, it's better that than him not survive. So a little bit of pain for long-term gain. Sorry, baby boy. We're gonna have to do it one suture at a time. Puppy. Never had to do surgery in bites of 5 seconds before.
No, this is crazy, but...
It's gotta be done.
Yeah.
Yeah, difficult. Just need to keep telling ourselves we're doing it for the right reasons. He won't survive unless we do this, so I'm sure he'll thank us eventually. Just if we want to do the right job, I know that it's tough, but I think we need to just put one more suture just on the inside. So if we gas it down one last time, then that should be it, okay.
So after the speed surgery and those little windows that I was able to place the sutures, I'm actually really happy with the cosmetic result.
And we're done.
The lips have come together. I feel that now he will be able to produce suction in order to feed from mum, and hopefully he'll go on to grow up to be a nice little Chihuahua puppy.
Bless him.
He makes the cutest noises, doesn't he? Oh, man, he wouldn't go to sleep, and I feel like I need to now. That was tense. We've put 3 sutures in, exactly where they need to be. He now has a nostril. He now has a fully formed hard palate. The fact that he fought us so much on the anaesthetic, that he was screaming blue murder at points, just shows his character, and that will really bode well for the future of this little guy. Yeah, gotta love him. We did it. Here he is.
Upstairs, it's been an agonising wait for owner Charlotte.
So literally just out of surgery, and it was very, very challenging, but he is as tough as nails.
Now you can see why I wanted to do it.
Yeah.
He's got such fight.
He really does. So we'll be taking the suture out in, well, maybe 10 days, 2 weeks. We'll see how it goes. We've put a non-absorbable one in there, so it will stay for as long as we feel it's necessary, until he's just a bit stronger and a bit bigger. But right now he's done great.
I think you need to name him.
Why don't we call him Cleft?
Cliff.
Yeah.
Yeah. Now to get him home, get him on mum, get him feeding, get him back to bright and alert like he normally is.
You guys better get off. He needs to go and have a drink, and I think you need one too.
Yeah. Agreed. Thank you.
All right then, Charlotte. Take care, sweetheart.
And you, bye.
Bye, little man.
In Isleworth, cat rescuer Liz is turning up with 3 of her latest cases.
I brought 3 cats in to see Scott today, very carefully selected from our little residential family. The first cat I brought is Mr. Tiddles. We've also got Mr. Woods, who's like an abominable snowman. And then there's Narnia, who's a sweet little petite black and white cat. And they're all ones that, although they're ticking along quite well, I want to make sure that their issues are addressed quickly, like if they need dentals, which are so important. So I know Scott's told me how important it is to keep their mouths healthy.
Liz runs a sanctuary that cares for hundreds of stray and rescued felines.
We started off as rescue rehoming, but then we found there were cats that weren't easy to home, maybe because they're either feral or elderly or have health conditions that need lots of support. And we're very vetty minded, so we try to keep up a good level of veterinary care for each individual cat.
I'm always amazed at your sanctuary how that many cats get on together.
They really make friends. It's incredible, yeah.
Yeah, oh, it's
hang
beautiful.
about together and form their little groups. And...
Yeah. All right, well, can we help Liz get these 3 into the consult room, please? In we go. Whenever Liz comes in with her cats, I really want to do everything I possibly can on the one day. She's got 200 cats to look after, and I've got one chance to get them right. So, Mr. Woods, I can feel he's got lumps of hair here and there and everywhere, haven't you, my boy? So definitely we need to try and sort you out. Wow, can I just point out how beautiful his eyes are? He's got 1 blue and 1 green eye, which is amazing. The only thing I would say about that is that there is quite a lot of scientific evidence about the presence of blue eyes and the pigmentation in a white cat leading to deafness.
Yes.
Quite an interesting quirk that we encounter with white cats with blue eyes is that some of them can suffer with hereditary deafness. So we don't know why there is a link between the colour of your eye and not being able to hear, but it is present in up to 80% of white cats. So we can hear that for sure. So if you call him again, please, Liz, I'm just going to jump.
Mr. Woods.
I think he probably is deaf in that left ear. The left side is where his blue eye is, so I think he is deaf on the left. Okay? But you got 1 ear that works and lots of buddies. So there you go. Never mind. Stinky, mate. I'm so sorry. Lucky you can't hear, because in this ear I'll just say you smell really bad. Sorry, but you do. A little bit of a spruce up. That's what you need, isn't it, mate? Hey? Mr. Tiddles was next, wasn't it?
Yes.
He's very handsome.
Oh. Mr. Tiddles, alongside being very affectionate, also is a little bit smelly, and I'm picking up that he's got some quite bad breath, so I think he'll definitely need to have some dental treatment, but also he has a little bit of dark pigment discharge in his ear that we'll need to clear out.
There we are.
Hello, beautiful. Hello. You are lovely, aren't you?
Next up is 4-year-old Narnia.
Oh, you're not making it easy, are you? So that looks like it's a little bit of snot coming out there. So she definitely has a little bit of a respiratory infection by the looks of it, Liz.
Yes, I've been keeping her separate actually at home.
Good. All right, Liz. Well,
okay.
If you say goodbye to little Narnia, and I'll look after her and the other 2, and I'll give you a call once I've all woken up.
That's lovely. Thank you very much. Be a good girl. I shall be looking forward to seeing them later, hugely. And they're such characters as well, so it would be lovely to know that they've had everything done and we're on the right road to having happy, healthy cats.
All right.
Thank you.
See ya.
Thanks, Jessica. Bye-bye.
What are you doing? You're crazy, aren't you?
Now you've only got the 2 of us. Is that going to be enough? Because I know I like 3 people on hand at all times. No, definitely not the first, and it absolutely won't be the last. The woman looks after so many cats.
At his Isleworth practice, Scott and Jess have started the Moggy makeover on 3 rescue cats.
3 of them makes for, well, a fairly busy afternoon, but hopefully by the end of their procedures they'll be happy and healthy and going back home with the lovely Liz.
First up is Mr. Tiddles, who needs some major dental work.
He's got some really pungent breath, which is why I'm wearing an outfit that looks like I should be handling toxic waste. I am a little bit, his breath is pretty bad, but what he does have is some pretty rotten teeth, which is the cause of his problems and his bad breath. And they're quite difficult to remove, but also it is only maybe a centimetre from the eye. So one false slip and you can literally stab it in the eye. Dental health is a really important part of looking after a cat or a dog, because when you've got tartar buildup, you've got a huge amount of bacteria lurking in your mouth, and then you're swallowing that every single day, which is having a really harmful effect on his liver and his kidneys and his general health. So to remove these rotten teeth removes the source of bacteria, and literally overnight the cat can feel $1 million. So you got 2 healthy roots there, and then you got this rotten stuff back here. Okay, so we can wake this boy up.
All done.
Yep. So he can go back, please, Jess. It's fine.
On to the next one.
Next, Narnia has a badly congested nose that Scott is going to flush.
So we're just going to wrap her up in a towel, put the cat muzzle on, and then give her a little injection in her butt, okay? Oh, there we go. There we go, there we go. Good girl, good girl, well done.
So brave.
Narnia is quite the feisty girl when you're trying to do things to her she doesn't like, and that's the reason why no vet or vet nurse will ever be a hand model.
Just a couple worries.
Ouch.
Thank you.
Yeah, try and get a sample of this stuff. Narnia is very likely to be suffering with cat flu. It's caused by 2 viruses, either calicivirus or herpesvirus, and can lead to a very snotty nose. Yeah, look at that. Gross. The best way to clear a cat's nose is by actually performing a flush, so putting a saline solution in one nostril, packing the throat, and have it fly out the other nostril. Oh man, that was gross.
It's quite a lot for a little cat, isn't it?
Yeah, loads. But I think that she is going to feel so much more comfortable, and as my Nana always used to say, better out than in.
Come in.
With little Narnia now more comfortable, the team can move on to their last patient, Mr. Woods.
Okay. So Mr. Woods has a few issues. He has some pretty disgusting ears, so we're going to give them a good clean. And whilst I'm sorting out his head end, the girls are going to be defluffing him. Oddly enough, I have an allergy to sort of certain long-haired fluffy cats. They just make my eyes itch and make me a bit sneezy. When I first met Mr. Woods in the consult room, I can tell straight away that he has some really smelly ears. It's actually horrible, isn't it? They have a lot of discharge coming out of them, and they do need to be swabbed to assess for the type of bacteria that are growing within them. And after we've done that, we're going to give them a good clean and a good syringe out with saline. So, how are you getting on?
Yeah.
Half shaven.
Half shaved.
All right, let's flip him over. For some reason, nurses absolutely love performing grooming on cats. I think they find it quite therapeutic, and it's a great way to see a before and after, knowing that a cat's coming quite mangy and going out looking quite sleek.
After nearly 4 hours, the marathon makeover on all 3 cats is almost complete.
He's done? Oh, all finished.
Right, so we've got healthy cat and half a cat, and we're all wearing the cat. He's certainly left his mark on the practice, hasn't he? Liz was concerned that Mr. Woods might be a bit of a handful, and the only handful he is a handful of fluff, because he's actually the perfect gentleman.
Narnia and Mr. Woods will be started on antibiotics for their nose and ear infections.
All 3 of them should really have a greater quality of life after what we've done today. So now they're just sleeping off in preparation for being collected by the lovely Liz.
Good boy.
Come on.
At the St. Margaret's practice,
Not going to the park, I'm afraid.
David and his 18-month-old spaniel Sega are arriving for an appointment with Scott's colleague, Vet Phoebe.
Hiya. Just got Sega for a checkup.
Hello.
Hi, how you doing? Come here.
Look at you. You're so cute.
She's got a little problem with her eyes.
Oh,
She needs to get checked out. Sega has been having discharge from both of her eyes, and one of them is worse than the other. So it's been going on a few months. So we thought we'd just bring her in and make sure there's nothing untoward.
Right, so it's this discharge that you've been talking about here.
Yeah, and sometimes it's all the way down to her lips. But I don't know if there's maybe a little bit of irritation in there.
Yeah.
I wondered if the cat maybe had nicked her and caused some trauma, or if it was something else. So I just wanted you to have a look.
Is the discharge always sort of clear, or?
It's like, clear or reddy colour.
Okay. So that means it's probably less likely infection, because normally if it's infection, it's greeny or yellow. So right away, I can see what the problem is.
Okay.
Right in the inner corner of her eye, where the discharge is coming from, I can see some small hairs, and it looks like they're probably rubbing on the surface of her eye.
Right.
Oh yeah, so it's the same on the other side. There aren't many, just a few little hairs, but you know how uncomfortable it is when you've got an eyelash in your eye, so...
And it's always there, it's going to be driving
It's always
mad.
there. It's not that uncommon to see hairs growing in abnormal positions on the eye in dogs. Normally when we see it, it's either along the bottom or the top border where the eyelashes are, not in the corner. If we were to pluck those hairs, then it would provide relief for her, but then they're just going to grow again. What I think would be better in Sega's case is cryotherapy, which is basically an ice pen, and you can use that to freeze the follicle, killing it and hopefully preventing recurrence of the hairs. We've done it before on eyelashes along the bottom rim with really good results, but I've never done it there before,
In the
so
corner, yeah.
it will be a first for me. I think it would be a good idea to do it.
All right, let's do it.
As it's a potential cure for her.
Sorry, Sega. Oh.
Oh, she thought she was coming in for a checkup and now we're keeping her. Oh, I'm really sorry, little one.
Come on. Good girl, that's it. How are those legs working today?
Before heading into work, Scott is taking some time out with one of his favourite patients.
Good girl, like a spring lamb.
His own elderly dog, Betty.
Today I'm taking Betty for a little walk to our local woods. It's our favourite place. It's a beautiful, magical place. It's a nice, calm place where a lovely, genteel old lady can enjoy herself. Come on, Nana. Here we go.
It's a big week for Betty, with a birthday soon and her annual checkup after a freak accident 2 years ago, followed by major back surgery.
Betty's got you.
Scott had been playing with Betty in the park when she suddenly collapsed.
She's burst a disc in her back, and some of the content of the disc is now squashing the spinal cord. Worst case scenario is she never walks again.
I knew it was bad, but it's really bad.
Betty's only chance of recovery was a risky spinal surgery, with no guarantee she'd be able to walk again.
Clever girl, look at that.
Fortunately, the surgery went well.
That's it, come on.
And after 2 weeks of intensive physical therapy, the terrier was able to take her first steps.
This way, baby. Come with Daddy. Should have a little rest.
These days, Betty still has a few niggly reminders of the traumatic injury.
Come on. Share a little seat here. It is true to say that Betty now has a disability. She does struggle to walk. She's weak on her left leg. I know. Oh, thank you very much. Hey, we'll do massages first. There you go, sit there. You like massage, don't you? Ooh, there we go. She is sort of wonky, really. She's got a tail that doesn't really wag. It sort of goes round and round like a propeller. And she just struggles on long walks. So giving her a little massage and a little nana break in the middle is fair enough. Is that good? Hey. Snuff all those muscles. We'll have to go and see your Uncle Michael soon, won't we? Hey, after he did his miracle surgery on you, fixed you up. Hey.
Betty's also about to have a birthday. So after the visit to Michael and hopefully an all clear, Scott is planning a special celebration.
I love my girl. Yeah, I do. Betty is just about to turn 12, which is incredible, really, considering everything she's been through. So in order to properly celebrate, we're going to throw her a 12th birthday party, which sounds absolutely bonkers, but we're going to do it anyway. And it'll be great. What do you think? I'll take that as a yes.
The party is planned for later this week.
Come on then. Let's go home. Come on. You need your nana nap, don't you? Come on, let's go. This way. Good girl.
Hopefully we'll be able to reunite them soon. It should be a really quick procedure, I'm hopeful.
Okay.
At the St. Margaret's practice, it's time for nervous 18-month-old spaniel Sega's surgery.
All right, should we go to sleep?
Graduate vet Phoebe is going to use a freezing process to remove irritating hairs growing in the corners of Sega's eyes.
Nice and sleepy.
With nurse Gina assisting, it will be the first time Phoebe has used the cryopen technique.
I'm feeling the pressure a little bit. Every new day, there's a new experience, there's a new thing to try, and so this is just another hurdle that I'm going to have to try and cross.
So now Sega's asleep and we get to have a sort of better look at the eye. Where the hairs are coming out, the tissue actually looks kind of different to the rest of the conjunctiva in that area. It looks darker. So what we could be actually dealing with here is a dermoid, which is an abnormal sort of growth of tissue, and that can have hair follicles in.
The advantages of the cryopen is that it's really quick, it's less painful than surgery, the recovery time is much quicker, and if it's successful, then Sega will be able to just go home today with a little bit of pain relief, and that's what we're aiming to achieve here.
So I'm just going to try and move these eyelids so I have as much space as possible, whilst also keeping that duct nicely out of the way and keeping the cornea covered. We're going to have to be really careful that we don't irritate the surface of the eye itself, because that is obviously a really sensitive area, and there's a couple of other structures in the vicinity that we're going to have to be careful to avoid. But the cryotherapy pen has a very specific diameter of the area it freezes, so we should be able to just target the hairs and nothing else. So hopefully at this point I can just remove these hairs now with these forceps, and they should just come out really easily.
But there's a problem.
My forceps just aren't gripping them.
The abnormal tissue or dermoid that the hairs are growing in is too deep, and despite being frozen, they won't budge.
No, they're not gripping them. I don't know whether I should just call Scott and see if maybe he can come and remove them surgically, because they're so deep. I don't want to penetrate too hard and damage other structures.
So I've been persisting with the cryopen, but I'm still not 100% convinced that we're getting the penetration that we need to with these hairs. So I'm going to need Scott's help for this one. We're going to need to go to surgery.
Is she stable?
Yeah, she's stable.
Okay.
So you can go and call Scott.
I'm here because my colleague Phoebe's found a dermoid cyst, which is actually quite an odd thing in a dog's eye. It's basically just a patch of skin in the eye, so clearly that's going to be quite irritating for the dog. But unfortunately, the cryopen, the freezing pen that we use, isn't really penetrating deep enough. And if it penetrates deep enough to kill the follicles, it might also damage the cornea behind the third eyelid. So that's why we are going to have to now move to surgery. Can you think what that would feel like, having hair constantly growing inside your eyeball?
I know. If I had one eyelash in my eye, you'd hear about it.
Yeah.
Let alone how many she's got.
A whole patch. Deep. See how deep I have to go to get underneath it. So that's the first one.
Oh, wow.
Let's come off. You can see the hairs on there. There's quite a few.
Yeah, there's like 10.
So I've just removed the first dermoid, and it was very deep, very close to the eye. So it was the right thing to call in the recruits for this particular surgery. Phoebe wouldn't have done this kind of thing before. It's very delicate stuff.
Scott is now going to take out the cyst in Sega's other eye.
There we go.
It's always quite satisfying when you can see all the hairs on it.
So by removing the hairs completely and removing the roots as well, the hair will never regrow. Right, so let's wake her up.
All right.
We had a bit of a hiccup at the start, a bit of a dramatic change of plan, but that's just something you have to adapt to as a vet. Her anaesthetic was nice and stable. Scott was able to come in really quickly and save the day. The eyelashes are no more, so yeah, we're all happy.
Sega will sleep off the anaesthetic before going home later today.
Oh, haven't you been brave? I don't think she's going to be happy till she's home. Home and tucked up in bed.
Hello.
Hiya. Who have you got there?
I've got a little bunny. Look at him.
In Richmond,
He's very sweet, he's very chilled.
practice manager Maz has brought in a rabbit that needs a new home after his owner passed away.
So I was thinking, could Auntie Nathan maybe just make sure little bunny is all okay?
Yeah, I'm sure I could have a quick look.
Come here, little bunny. There we go. What a good bunny.
What I'm going to do is start off looking at the teeth, because with rabbits, because their teeth constantly grow.
Oh, okay.
And a lot of rabbits now, they got malocclusion, which means their teeth don't match up and they don't grind down, so they often grow really long. Yeah, so those teeth are quite misaligned.
Oh, yeah.
But certainly could do with a little trim. So that just in between those teeth there. So it stops me catching on the tongue. And I think, this will really help with those two teeth meeting up again.
Good boy.
That's one side done.
All right.
Now it's just onto the other side.
Oh, so the heart's going crazy.
Yeah. Yep, that's the other side done.
Oh, that's going to be better, though.
Have you got any ideas for a home yet?
I'll take him home tonight to make sure he's okay and he's eating all right. I'm sort of the only human that this bunny has right now, and I suddenly feel very parental with the whole situation, a bit of a sense of responsibility that this little guy's going to be looking at me for some kind of guidance, and I'm his mummy for now.
So what are you going to call it then?
If you name him, then you keep him. But he does need a name. He's my little buddy. You're my little buddy. Come on, then.
Back in Isleworth, cat sanctuary owner Liz has arrived to collect her 3 patients.
I'm not really missing them because I know they're in good hands, but I shall look forward to seeing them. Yes, very much. Goodness me, look at you, Mr. Woods. Wow, look at that lovely fur.
He looks great,
that must
doesn't he?
feel nice, mustn't it?
Hey, if you weren't a hit with the ladies before, you're definitely going to be with a new hairstyle.
Going to feel like a new
nice
man,
breath.
aren't you? That's lovely. Oh, you're a very lucky pussycat, aren't you?
So while you snuggle on him,
Yeah.
Mr. Tiddles had 7 teeth removed.
Gosh.
So we've had to remove all those teeth, but he's going to feel so much better with them gone.
Oh, that's really good. He's such an affectionate cat. It'd be
He
nice
really
to see
is.
him all comfy and happy.
But this madam, wow. She went from a lovely, demure feline to a caged beast when you try to do anything to her.
Really?
One of my nurses has a nice battle scar all the way down her arm to prove it. So, but there you go.
Oh, goodness me, Narnia.
So she had some pretty mucky ears, so we've cleaned out her ears. But the bigger thing, which was actually quite rewarding and disgusting in equal measure, was flushing her nasal passages, and a huge, big lump of snot came flying out. So by flushing that out, it's going to make a massive difference to her quality of life immediately. And I actually feel already she's breathing a lot quieter and a lot better as a result.
I think all of our cats at the sanctuary, they're like a family. And our team of helpers there are so passionate about them and so proactive with them. And the work we do means everything. It's part of my life, seeing that we can help these cats and do something positive to give them a good life.
I'll take the heavy one. You take Princess, troublemaker. All right, and let's get you out to that car. For someone that looks after so many cats in her own house, gives up so much of her time, she's an absolute marvel. She is the queen of cats. So you're all very lucky pussycats, aren't you? Hey?
Up we come.
At the St Margaret's practice, it's also time for Phoebe's patient, Sega, to go home with owner David.
Hello,
There
puppy.
we go.
Sega. Hello. Hello.
Oh.
How you doing? You all right?
As soon as Sega came up the stairs, she went bounding into David's arms. Obviously, we have to do procedures on animals and we don't like to separate animals from their owners, but it's always lovely to see them reunite again at the end of the day.
Everything went well. We tried to use the cryopen, and when we were freezing the hairs, we noticed that they were a lot deeper down than we thought. So Scott had a look at it as well, and we think it's a dermoid cyst, which is a little patch of abnormal tissue in an area where it shouldn't be. But in her case, that little bit of abnormal tissue is growing hairs that shouldn't have. So we've removed that in its entirety. And then hopefully she should make a full recovery and no more hairs.
I'm glad she's not going to have any of that irritation anymore.
Yeah,
She'll be able to
exactly.
just swim and run and do what she normally does without any of that irritation.
Exactly.
Yeah. All right.
She should feel a lot more comfortable.
She's obviously been through a bit of a trauma today. She's feeling quite sorry for herself, but I'm glad she's okay and it went well, and she can, get on the road to recovery. Say bye.
Bye.
Soppy dog.
Yeah.
Someone's home. Hello. Hi. Oh, wow. A little handful of cute there.
A few days later, Scott is making an important house call. to check on tiny cleft palate patient Cliff.
So that's proud mum Dolly, yeah?
It is, bless her.
Hello, you about to feed your babies?
Cliff's holding his own with his brother and sister. He may be the smallest in the litter, but he's certainly not the quietest.
But I can see at the same time that those sutures and just the abnormality that he's suffered with is going to mean that long term he's going to struggle to latch on and consume as much food as his brother and sister. So I would suggest that we do kind of supplement him with a little bottle from time to time.
Definitely. Funny you should say that.
Ah,
I think you should do the honours with this one.
Oh, yes, please. Look at this. Hey, there you go. Oh, you're going to have some? It's a really wonderful, special moment when you get to bottle feed a puppy because they are looking at you like their mum. They're pouring at you with their feet, trying to sort of pressurise the milk as if they were latched on to mum still, and it's a very special moment for me. Well, I think if this feed's anything to go by, he won't be long before he's catching up with his brother and sister.
No.
Hey, little man.
No, no time at all.
Hey.
Good boy.
Good girl. That's it. Uncle Michael's house. Yeah. Let's see if he's there, shall we?
It's the week of Betty's 12th birthday. But before the celebrations get underway...
Hello.
Hey, how you doing?
How's it going, mate? You all right?
Coming in. Hey, Betty.
She's due for her annual post-op checkup with Scott's friend, specialist surgeon Michael Hamilton.
That's right, Betty. There we go.
Normally, whenever I see Michael, it's for a social visit, but this time round, I am a client.
I'll tell you what then, Betty. So I'm just going to give you a little stroke/neurological exam.
Betty is an old girl who suffered a major injury.
Okay, that's pretty good.
So I'm really just coming to see Michael to make sure that she's not painful and just to get a little bit of reassurance.
Pretty strong.
Well done.
Not bad.
Good
Not
girl.
bad. She doesn't look sore to me wandering about. She's not walking normally clearly. She's just a little bit weak and weaker on her left side.
Well, I mean, it's a massive relief for me that she's not in pain. And sometimes as an owner, it's really hard because you have that emotional vested interest to go, oh, are they painful? And you don't want them to be.
I know the feeling. Yeah, that's all fine, isn't it? The cause of all her problems is the injury that she sustained 18 months ago, and primarily the kind of an explosive kind of concussion within the spinal cord. There's nothing we can do about that. So I think, relatively speaking, she's doing actually pretty well. All right, Betty.
Hey,
It's good to see you again, though. She's going a bit grey, like me, but she's in great spirits, not painful primarily, and not getting worse. I mean, I think she looks quite good.
She's an older girl then, but we all have good days and bad days.
Yeah, absolutely. I mean, I think she's managing admirably. You guys are managing admirably. Yeah. But I think how old is she again, 11?
She's 12.
12-year-old dog, I think she's kind of doing all right.
Yeah. To know Betty is not painful and that she is behaving as expected from the surgeon himself is the most important part for me. There you go. Uncle Michael said you're not painful, and that's good.
What do you reckon, Winston? Are you wondering what type of dog he is? Oh, are you giving him your ball to play with?
In her home in Surrey, practice manager Maz is introducing Buddy the bunny to her dog, Branston.
Not sure he's going to go for that game. No. It's pretty cool seeing the two of them interact together. It's so nice to see that Buddy's really chilled and Branston's quite happy with this long-eared puppy that's been brought into the house. Right, Brenny, you've got to talk Daddy into keeping him. Just both be cute.
Branston seems to be okay with the new arrival. Now it's time to win over Maz's husband, Chris.
Hello.
No.
Hello.
Oh, hello.
Oh, who's this little guy? I was expecting to see
Well, that's
Dave, but not-
Branston.
Okay, good.
Hello. So Chris hasn't freaked out that Buddy's here, but I think maybe if he has a cuddle, it might just start to seal the deal a bit. This is Buddy.
Hey, buddy.
There we go.
Hello. I can't believe how chilled out he is. He's just
Isn't he?
laying there, not moving.
He's really chilled out.
And what is he going back tomorrow and finding a home, or?
It's funny you should mention that, actually. Brandy, look at Daddy. Can we keep him? Can we keep him?
Well, is this your idea, Brenny? Well, looks like we've got a new member of the family then.
Yay! It's a great result to know that Buddy's going to now be a part of our family, and it's a great end to a great day. So happiness all round.
Benny, high five, you want to keep him? Yeah.
Yay! Oh, welcome to the family, Buddy.
Hey, Buddy.
Ready?
A week after her eye operation, Spaniel Sega is enjoying runs back in the park, much to the delight of owner David.
Good girl. We'll do a high five. High five. It's great being back in the park with Sega. She is in her element, running around and chasing the squirrels and doing all of those things that she likes to do. That's a stick. Where's the ball?
Vet Phoebe is on her way to check on her little patient's recovery.
Sega, come sit.
Hello.
Hi, how you doing?
Good, how are you?
I'm all right.
It's amazing to see her out here.
Good girl.
Obviously, she's really good in the clinic, but she's just in her element here, isn't
Absolutely.
she? It's really brilliant when you get to see your patients out in the park living their normal lives rather than just seeing them in the clinic where they're a little bit unsure, a little bit uncertain. Sega's just transformed.
You can see she's back to her old self.
Yeah.
Trying to take the stick off me. There you go, have it. Yeah, she's much better. She couldn't wait to get that cone off and just have a run around. Sega, good girl. Come sit. Let Phoebe have a look at your eyes. Come on, good girl.
Let's have
Thank you
a
for the
little
paw.
one. There we go. I think this is the first examination I've done in the park. Oh, they're looking really nice. Sega's definitely on the road to recovery. A lot of the swelling has come down, but the stitches are all holding in place. So when those come out in a couple of weeks' time, they'll just dissolve on their own, then she'll be back to normal.
As soon as she can get back in the water, then that's 100%.
Yeah.
But yeah, she's much, much better.
It won't be long, I promise.
Sega is incredibly important to us. We can't imagine not having her now. Now that we've got her, we're just very relieved. It's not something that's going to just recur. So, yeah, we're very happy with the outcome. She is the happiest dog I've ever seen, I think. She wants to be friends with everyone.
As long as she's got her stick and her ball.
Yeah.
You excited to see Betty for her birthday?
In Richmond, it's time for Betty's special birthday party, and Scott has invited clients, family and staff to join in the celebrations.
Thank you. Betty, look, they're all for you. Look. Look.
Hi, Betty.
Hi, everyone.
Hi, everyone. Hello, dog that looks exactly like Betty. Betty, come and look. Look, it's a doppelganger.
This party for Betty makes me think back to everything I've been through with her, but also having all the wonderful clients come in with their dogs and reminding myself of all the journeys I've been on with them. So many dogs, a real kaleidoscope of canines.
Beer for dogs. You know me so well. Hey, Bobby, how are you, mate? Good to see you.
Okay, best wishes for Betty.
Oh, thank you very much. Oh, good. And still wagging that tail, what she has left of it.
Do you want a party hat? There you go. Happy birthday to Betty.
Oh, thank you. Oh, wow. How cool is that?
Betty is an integral part of our family. She was actually with Scott before we met, so she predates me, and boy does she know it and let me know it sometimes. But she's as much part of the family as any one of us. Happy birthday to you. Happy birthday to you. Happy birthday, dear Betty. Happy birthday to you.
So obviously Betty's a very, very special dog to me, and she went through a fairly significant injury a couple of years ago, and with the help of colleagues and family and friends, she made it through. So it's wonderful to be able to share this special moment with you guys, because I know how much you care about your dogs as I care about mine. When you think that 12 years of your life, that's a huge amount of time, and I've had Betty right beside me the whole time. You know, she's been a constant, steadfast companion. So celebrating 12 years of her life is also celebrating 12 years of my own. So it's pretty special. So thank you so much for sharing your love with my little dog on a special day. So thank you very much. Yeah.